Probably the biggest thing that affects the quality of life as we get older.
Yeah.
And you talked about the spine.
The spine is
Yeah.
really, really important. I mean, that's why a lot of people are doing like Pilates now more often. And
Yes, I've noticed.
yeah,
Yeah.
this is super important for people for longevity.
Yeah.
You only get one spine, so you can't.
Yeah, it's not like teeth. Where
Yeah,
you get
exactly.
a second.
So you really got to be careful.
What are the most common complaints when people come and see you?
Oh, I've got a little bit of a pinch in my spine, or a sharp pain, or dull ache. It's like, oh, and I'm like, where do you feel it? And they're like, all around my back. And I'm like, okay. People working in mostly offices tends to get their spine much more weaker. They're sitting down, static all day. They don't strengthen the muscles that need to actually stabilize the spine. Exercise is very, very important. And also making sure your body's at its strongest as well. Even the nervous system gets overworked throughout life.
Tell me about it.
So yeah, so you need to maintain some sort of training, get that full range of motion. I think it's really healthy to have, you know, hip opening, spinal movement, rotation of your shoulder, you know, picking up your child if you want, you know, that stuff. If you can't do those things, it's like.
Welcome back to Dr. House podcast. We always talk about aging on this channel in terms of how we look as we age, our skin. We talk about the diseases, our health. But there's one thing which we haven't really covered up till now. You know, it's all very well and good getting to the age of, let's say, 70 or 80, looking pretty good for your age and not having any diseases, not having any medications. But if you're hunched over like you're an ogre in a Disney film, your quality of life is going to be pretty awful. And I think the flexibility and range of motion in your joints that you have and the ability to use your hard and soft tissues as nature intended as we get older is just as important as the way we look and whether or not we have certain conditions and whether or not we have certain medications. But because it's not talked about very much, I don't think the knowledge on how to maintain that as we get older certainly isn't taught in school. Certainly it's not taught at university to any level. And unless you have a problem, you tend to not see anyone about it. But my guest today would agree with me when I say the best way to maintain that level of usage of your body as you get older is to start before you get a problem. Prevention is much better than a cure, as I'm sure we can all agree. And so to that end, I have an expert in sports massage today. His name is Ramone Lawrence. Ramone, thank you very much for joining me today.
Thank you so much, Alex. Yes, thank you. Thanks so much.
So I'm looking forward to this because, like I said, in this channel, we've never really talked about this.
Yeah.
And I think when you talk about aging, people typically say the usual things, like I've just said there, the way we look,
that's it.
What disease we have, do we still have our memory, etc., etc.
Yeah.
But being able to use physically our body is like a completely different category. You can tick all those boxes.
That's right.
And still have a poor posture and poor flexibility.
100%.
And it has just as big an impact on your quality of life as those other things, right?
Oh, exactly. I mean, with muscle weakness and any type of dysfunction, especially when you get to an age where your body starts to degenerate quite a lot. Exercise is very important. And also making sure your body's at its strongest as well, not just the tissue, but also the joints as well. Even the nervous system gets overworked throughout life.
Tell me about it.
So so you need to maintain some sort of training.
I'll tell you what, we'll come to that.
Yeah.
We'll come to that.
All right.
Before we go to that, just give people a little bit of intro to yourself.
Yeah.
Just so they understand your background.
Okay.
And then figure out how you got to be where you are.
Yeah, no worries.
Why you enjoy what you do.
Okay, so I'm a sports massage therapist. I've been working as a sports massage therapist for about 3.5 years now. Worked in many places, in different clinics. And now I'm trying to focus on going into a different field with physiotherapy in the future. Been treating many patients from ages from 20, 30, 40, 50, 60, 70, and 80 as well. So I've seen quite a few spectrums of ages. But yes, I've been loving my field, helping people, increasing their range of motion, releasing trigger points as well, and lengthening tissue, which is a blessing in disguise, helping people and seeing them feeling happy, and actually being happy and getting results. So it's a good thing.
And I think it's people underestimate how much happiness they get from doing things like that.
100%.
Do you find that people come to you sometimes thinking, I just want a general massage,
Yeah.
and you do your thing,
Yeah.
and suddenly they realize, oh, I can do this range of motion again, and they didn't know.
I had so many patients when it's like, oh, I just want a quick massage. I
Yeah.
was like, okay, yeah, sure.
Yeah.
I mean, they're booking half an hour,
Yeah.
and then afterwards, give them a little bit of effleurage work, petrissage work, and then afterwards, like, do you know what? That actually feels quite nice.
Yeah.
Can I book in again? Yeah, of course you can. So yeah, it's nice. It's nice to see that people realize that, oh, touch, biomechanic work, or just movement, or just kind of like some type of movement or touch can help. And then they see a bit of a difference. And of course, there's some people that never had a massage, and there's some people that always had a massage, but it depends on the person as well. But the results are always a bit different for some people.
Yeah.
But majority of the time, you get really good results. Yes.
Yeah. So you mentioned at the start that you work with patients of all different ages.
Yes.
And I'm intrigued, from a channel which focuses on cosmetic and longevity aspects of aging. What do you notice that gets worse over time from an aging context to degrade the quality of life and things associated with that? That are the most common things?
I would definitely say the lymphatic system.
Yeah.
That definitely gets really jacked up, I would say, over time.
Okay.
Due to the fact that blood circulation gets decreased. So your lymph nodes and your lymphatic system basically reduces as well. Hydration is another one that I feel like that gets decreased over time when I'm treating elderly.
Yeah.
Majority of them do say to me, from my point of view, they do say to me that, oh, they've been drinking enough water, but then when I'm doing a lot of work, it's like there's a lot of edema building up in the legs or around the foot. And I'm like, okay, is that their own condition? Is it a heart condition? So of course I have to write down my notes, but it's just a general thing where I've seen quite a lot. Definitely their range of motion, it decreases at a certain age. Get a lot of excessive kyphotic curvature where the spine gets like bent over basically from the thoracic. So working into these areas, I always see a lot of weakness as well.
Like muscular weakness.
Muscular weakness, sarcopenia. So that's another thing that happens a lot as well. So it's not about, of course, it's about strengthening exercise, but it's maintenance as well. That's the key thing for when you get to that age. You only need about around 70 minutes or a week if you're a certain age as well, like maybe around 60 plus. That's what they usually say, 70 minutes. It might have increased recently, but generally it's good health if you can maintain that. So those are usually the areas where the spine goes a bit forward. Of course, the spine starts to fuse a little bit when you get older as well. So strengthening the muscles will help hold that spine in the right place. So
I think that's quite some of those things I think you can probably predict. Like for example, you said the muscular weakness and the need for training, the range of motion. Some things I wouldn't have expected, like hydration, for instance. But then obviously that is majorly to do with obviously your diet and lifestyle.
Definitely.
Which then impacts things like your lymphatic system as well. So all those things that I'm sitting here thinking they're not necessarily completely different things. They are all like jigsaw pieces.
That's it.
And they're all connected. So why don't we work through those then? So one of the things you said, and I think we'll jump to this one because I think it's what people generally tend to have in their heads, and it's probably the biggest thing that affects your quality of life as we get older. And you talked about the spine.
Yes.
And I think, correct me if I'm wrong, but I would guess that for your work, that people that come to see you and your colleagues that you work with in clinics, the back is probably the most common part of the body. So let's definitely get into that because people don't have so many questions about that. What are the most common causes of loss of quality of life as we get older, in your perspective, in terms of the spine specifically?
I would definitely say due to people working in mostly offices, that tends to get their spine much more weaker. They're sitting down, static all day. They don't strengthen the muscles that need to actually stabilize the spine. So like the multifidus, for example, that one is a real good stabilizer. It's like a really...
Where's that on the spine?
So multifidus is a really deep erector spinal, erector muscle. So it keeps you erected.
Okay.
and it also stabilizes. So
it's very close to the spinal column.
it's really close. It's really close. It's literally like embedded into the transverse process. So you've got your transverse process that comes across, and then you've got the spinous process that comes in the middle. And it's embedded in those two.
Right.
So it's like a bridge.
Yeah. And for those that are wondering, transverse process, if you think of the discs in your spine as like an actual CD shape, there's a bit that comes out on the side, like a sort of, what would you describe as like a wing almost?
So they're like your wing.
Yeah, in layman's terms.
Yeah.
And then your whole disc can do this and do this. And you've got a bit that comes out the back as well. These sort of wings stick out. And these are called processes when it comes to anatomical terms. So you've got here, processes that come out of the skull as well, for instance. And muscles, what you're saying, is interlocked within these processes to help basically articulate, I guess, the disc.
Just to stabilize those areas. So when a lot of people have a bit of weak, especially when they get older, when they get those muscles that are really weak, or the muscle gets really shortened, it starts to play around with the spine and get really, really tight.
So I guess when it shortens, it kind of makes the spine lean more to one side.
Yeah, it'll start to shift to one side. So you have a little bit of like a articulation of rotation on one side, and one of the facet joints will go like this. So you'll start to rotate left and then into the right. And then other muscle groups surrounding it will have to get overused because of that. So in the spine is really, really important. I mean, that's why a lot of people are doing like Pilates now more often. And
yes, I've noticed.
Yeah, because it really helps with the spine and the core. Right. I mean, the muscles around the spine, you have to think of like your psoas as well, which is in front of your spine, that connects into the spine, goes through the hip.
Yeah, that's kind of at the front. It's where the leg sort of meets the torso, right?
That's right. It's the only connection, like the bridge from the top to bottom, that really connects both portions of the body.
But how do you spell psoas? Is it PSOAS?
PSOAS, yeah. Okay. Psoas major and psoas minor.
Yeah.
But those are really important as well. They tend to get shortened because a lot of people sit down in an office.
Okay.
And that starts to play up with the spine from the anterior and posterior side, so the front and back.
Why does it shorten if we sat down? And because surely when we sat down, we're not putting a lot of tension into things like we're in the middle of a squat or anything. So why is it that causes?
It's over time. This is over time for people that get to a certain age. When they sit down, basically like office workers, because Canary Wharf is a big office base area. So when they sit down, the muscles starting to shorten over time, not just in like a day or two. It's like over the time of years. And that's
so it's like an almost atrophy type of change.
That's right.
It's just wearing down from not being used.
Yeah,
that's what it is, right?
Exactly. And that's what affects the spine quite a lot. And it changes the pelvis in the structure and the biomechanics of how the spine is supposed to be moving. And when you keep going up the spine, this is where a lot of weakness starts to happen, because there's more load through the whole lower back, upper back, and then to the head. The head posture is another thing as well.
Yeah.
Where the muscles around the rectus spinae, your rectus spinae is the muscles that come across all across the transverse process. So if you've got your transverse process on the side, they're like pillars, like a column that come up to the top, and they support your whole spine and also translate force all the way through rotation. You've got flexion and extension as well, and then you've got your stabilizers. Those stabilizers are the ones that need the strengthening to keep you upright. And over time, they get weaker, shorter, and that's what I've been seeing when I'm doing the massaging. When I'm showing them tests, if I say, oh, you can maybe do a cat-cow for me, when you're going extending your spine and flexing, there's no movement in there.
Right, so it's all like one major unit.
Yeah. So when I'm seeing them move, it's just restriction. And it's usually coming from the spine, and the only thing that is moving is the whole back, but not the individual facet joints that are moving.
One big giant slab.
It's just this, and I'm just like, okay, we need to bring it back a bit. Let's focus on your actual movement of your spine. This is super important for people for longevity. You only get one spine, so you can't.
It's not like teeth. Get a second chance.
Yeah, exactly. So it's really important. So when I'm doing massaging, I always focus. In the clinic especially, we always focus on the spine health with our chiropractors, our physios, our osteopaths as well. That's the key thing. I mean, degeneration is you can't stop degeneration. It's a normal thing. So
just minimize it, right?
You can only minimize it, So maintenance is key. Maintenance is very key.
And you alluded to something there. You talked about going to the top of the spine.
Yeah.
And we also mentioned things like the multifidus, which is going to be a lot lower down the spine, and the psoas, which is much lower down on the front side of your trunk as well.
That's it.
So if you've got a problem in the lower portion of the spine, that you mentioned head posture.
That's right.
Is the ultimate end to lower portion spine problems head posture changes as well?
It can be. It can be. It depends on because it can translate to force as well. So fascia is another thing you have to think about, the superficial and the deep fascial chain.
Okay, and
So
fascia, for those that don't know, are connective tissue basically.
yeah, that's right. Yeah, and it can start to form into the actual tissues of your spine as well. So the multifidus, the spinal going up into your neck. So you can get forward head posture.
Yeah.
You can get a little bit of more load through the neck as well. And that can play a lot on through the actual middle of the back.
Yeah.
And also in the front as well.
Yeah.
It can because your spine and the rib cage are connected. So
Yeah.
that does play a big part. So with your neck as well, what I do tend to see when it gets to a certain age group,
Yeah.
the head posture gets weak. You get a lot of stiffness in the muscles of the neck.
Yeah.
And then also this is where people get a lot of headaches as well, through the base of the head and the neck. So when I'm releasing something like the suboccipital muscle groups, those are basically the back of your head,
Yeah.
just around the back. It starts to become very tight. A lot of muscle spasms releasing through those areas, and also very, very sensitive. So you really got to be careful when you're releasing those areas, but you still need to add a little bit of load to kind of work into them.
Yeah.
That's what I see when I do those results. When I'm pressing down on those areas, put a bit more pressure than normal, just to release those areas.
Yeah.
A lot of forward head posture as well. That's another thing that I tend to see quite
Like
a lot.
just leaning forward like this.
Yes.
Yeah.
So leaning forward and the load is going through the whole T, basically the top of the spine, basically where the cervical connects into the T1, which is just on the
thoracic.
top.
Yeah.
So I see a lot of load through that, and rotation is limited as well.
In the spine or the head or the neck?
In the head, head especially, I see that quite a lot. Just doing a couple of tests and seeing how they're doing. The rotation, tension especially as well is another one when they're looking up. Is limited to just there. And you're like, okay, right, we need to step back a bit. You're going to the gym, but you're not focusing on your spinal health. That's another thing as well.
Oh, I'm 100% going to get into that today as well. Yeah.
So no, definitely is really important to focus on the whole spine, not just the lower back. The whole spine, from the lower back to the thoracic to the cervical. They all are connected. If you're using one section more than the other, then the load will be placed on just that area. For example, if you're focusing on just your lower back, trying to get flexibility in there, then the other fascial joints will have to take more of the load. The fascial joints get bigger and bigger with the lower it gets. So the load goes at the bottom. But if you're not just focusing at the bottom, you need to focus at the top as well. Vice versa.
I mean, it's like when we lose teeth, for example. I used to be a dentist. I retired many years ago. But when people try and think about one particular tooth, that's fine. No, if you try and save that tooth, but maybe shaving a bit off the top to bring it out of the bite to reduce the load on it.
Right.
Everything else now has a bigger load.
Okay.
And you're sharing that load.
Wow.
So as soon as you minus one another, you plus it on another. It's a zero-sum game.
That makes sense. Okay.
And I think what you're saying is similar in terms of the spine. You can't focus on one.
No.
If you take something out of the wall, one brick, all the other bricks are now taking more loading force.
Take more load, definitely.
And it's interesting to see that you're saying head posture, headaches, things like that start to go as well.
Yeah, that's it.
I think people also will be news to them that sometimes when we have headaches, it's not a chemical problem where you have to take drugs. Sometimes it's a physical problem.
That's right.
As well. And this is, I think, a key part of aging.
100%.
So when it comes to the spine, what are the most common complaints in layman's terms? When people come and see, what language do they use? What are the most common things? Is it literally just, I'm curved in my spine, or I've got pain more on one side than another, or something else?
So there's a big, vast complaint with, I've got a little bit of a pinch in my spine, or a sharp pain, or dull ache, or even like I can't open up a bit from my chest. I feel like there's something inside that feels weird. So I'll get all these weird things where it's like, and I'm like, what do you mean by that? And it's like, I can't explain it. And I'm just like, okay, where do you feel it? And they're like, all around my back. And I'm like, okay, so
a lot of specific.
I'm just like, all right. So down the line, that's when I start to get used to what they're saying. I'm like, okay, if they're saying around this area, let's focus on that area. But at the same time, majority of the time, they may have that pain there, but the actual problem might not be there. It could be somewhere else.
Yeah.
So I say, okay, let's do a couple of tests and see.
Yeah.
But usually when people say, oh, it's sharp pain, I think, okay, it could be compression of the nerve, impingement. It could be that it might be having sciatica, another form of impingement through the nerve. It could also be something like spondylolisthesis, where it's a bit inflammation through those areas as well, or the facet joints where they just collide together. So it could be
it's a big mix.
Yeah, it could be a lot of things. So we have to do these tests to make sure that there's not an actual problem, or is it just weakness that they actually have.
So when someone comes in, let's pretend I've come in.
Okay.
I've given you some descriptions of my complaint, which are not very helpful because I don't know the technical language.
Yeah.
How do you go? What kind of tests do you actually do? As a sort of spinal MOT. To see what's happening.
So say, for example, you had pain in your neck, for example, and you're getting it referring down your hand or your tingling sensations, or you can, when maybe you say to me, oh, Ramone, I've come in and I'm getting some pain through my hand and my neck. I don't know where it's coming from, but I can move my head, I feel fine. I'm like, okay, well, let me do something called a Sperling test, where you take a seat or you can stand up, put my hands on top of your head, press it down and compress. If I get any feedback where you're getting sensation through your hand, I'll be like, okay, you're getting some type of form of radiculopathy, which is basically compression on the nerve going down into your hand and fingertips, basically.
And I guess just for those watching, the reason we do, we ask patients, do you have any tingling sensations, pins and needles? The brain is obviously the main focal point of the nervous system.
That's right, the central nervous system.
And then we've got the central nervous system going through the spine, and the peripheral nervous system, which comes out from the spine. So there's a problem with the spine. Then, and that compresses the nerves coming out into our limbs. The signal is kind of fading. It's like a flickering light almost, and that's why compression shows pins and needles. Pins and needles.
So we have that's when we have a lot of tests to see if there's any other impingements through those areas. So we compress, and then we're like, okay, we're getting a sensation through your hand. Okay, cool. Let's do another test. Let's test your actual nervous system through your hand, and maybe do a bird's eye test as well, or a nerve flossing test to see if there's any pinching through the radial nerve, the ulnar nerve. So there's many types of tests to pin it down to what it is. And then from there, we were, okay, you may need to see your osteopath, or you may need to see the physio. But from my standpoint, I'm like, okay, I noticed that, I'd write these notes down, let's work in these areas, and then I'll give you some exercises behind after that as well. And then you go from there, do your exercises, and then we can strengthen those muscles afterwards. But the key thing is, if you're getting pain and you don't know where it is, these are the tests that we do to kind of like finalize those areas.
But what else do you do apart from compression? Any range of motion tests at all?
Oh yeah, we do range of motion tests. We check your range of motion with some of the devices we have as well, and we just see how far your range of motion is. If it goes past the average range, then we'll be like, okay, you've got like really increased range of motion here, let's check the other side, and that tends to say, okay, you've got a decreased range of motion, so maybe the muscle groups are using more strength to kind of push you to one side. And then we do another test where we're checking the strength of the muscle, the resistance as well, so resistant range of motion, where we're actually activating your muscle groups on one side to see against my hand or my palm. And if it's weakness, it will just say negative, your head just drop, and then you will say, okay, we need to strengthen those muscle groups, or we need to actually relax the nervous system a bit more. And then we've got active range of motion, where we're bringing it to its full range, and then passive, where you're doing it yourself, and we've seen how far you can go yourself without any of that help at the end.
So let's go through those. I think that's really interesting. So you talked about you want to test the range of motion. Could you give us an idea of which particular movements you look at? And also give an idea, because I know some people who are watching this trying it themselves. What do you expect to see as a minimum? To say everything good?
So for example, if it's something to do with the neck, I'll tell them to look left, look right. If I see any decreased range of motion on the device, or just by my eye, so I usually use my eye, and then if I'm like, okay, that doesn't look right, let me use a device. If I see a restriction of range of motion, so if, for example, if I'm seeing, someone's looking to the left and there's only like a 34 degrees of rotation to the left, I'll be like, all right, let's see what we can do
So
here.
if they're only getting to about there.
Yeah. Then I'm like,
Like that.
right, that's a bit of a problem. They can look left, but then they can look full right all the way. Then I'm like, okay, what muscle groups are there?
What do you mean by all the way?
All the way to the right. So we're looking all the way to 90.
At 90 degrees.
90 degrees.
Okay,
Yeah.
got that.
90 degrees. And then maybe 34 on the left, which I had a
Yeah.
patient like that before
Yeah.
last week. Then I'll be like, okay, what are the muscle groups that I need to work on?
Okay.
And then also, why has that happened? The history behind that, and what can I do to help them?
Yeah.
So my main mission is to find out the restrictions of the muscle groups, and then release those muscle groups, lengthen them, and then give them a little bit of reassurance that it can get better.
Okay.
So when they have a decrease in range of motion, you want to make sure that you're targeting the right points. Otherwise, you're just doing nothing.
Yeah. So that range of motion test, it's a movement test that gives you an indication of soft tissue length, almost muscular length,
and joints
and joints as well.
Because
articulation.
it can be the facet joint that is locked up as well.
Okay.
So with the facet joints, if they could be like this, where when you look into your left, they're blocking each other.
There's a clash almost.
Yeah.
Yeah.
So that what tends to happen as well. But then also the muscle group can be shortened as well. So that locks into place as well. So everything is just jacked up.
Yeah.
Where you're looking to your left and I'm like, okay, what happened? And they'll be like, oh, I just woke up.
Yeah.
I'm just like, okay, that could be a problem. So yeah, it's checking the range of motion from the facet joint.
Yeah.
Any pain that's causing them to stop.
Yeah.
From the nerve. So when they're looking to the left, ow, I can't move anymore.
Yeah.
Okay, what's going on here? Is it impingement that's stopping them? So that's another one where the impingement is squashing down a nerve and giving it a shooting pain through the whole neck.
Yeah.
And that's what's telling them to stop, basically.
Right.
So that's another dysfunction that's going on.
So in terms of that range of motion, obviously you mentioned the side to side and this. What about front and down and up? What kind of range of motion would you expect from someone?
So from
people watching to try.
Definitely, yeah. So I will definitely say a good range of motion, 30 degrees of flexion and maybe 45 degrees of extension, but people are different. Yeah.
Okay.
Yeah. So some people are different. They can go all the way back, all the way up, looking up. As long as you can look all the way up without any type of pain, that's a good sign. But if you're getting pain from the back of your neck when you're looking around 40 degrees, then you can be saying, okay, I need to see somebody.
Right.
Because it could be anything along with the joints, the muscle groups, or the nervous system.
Fine.
Yeah. So it varies. It varies for a lot of people. But you should have a good range of motion from looking up or down, left or right, and side to side.
Okay. And what about the tilt?
Yeah. So tilt is about 23 to 24 degrees range of motion.
Fine.
So you should be able to tilt your head without your traps coming up or your shoulders coming up.
Yeah.
If they do, then like, okay, you got some tight muscle groups that need to be released.
Okay.
Unless you're a bodybuilder, I'm pretty sure, but like, really jacked up, then
overly built muscle.
then you're quite restricted.
And what about in the actual spine? So for example, in not thinking about the neck now, but the main portion of the spine, which in anatomy, I guess we're talking of, just as a note for the viewers here, when you look at the spine from top to bottom, we class the groups of the discs. So the very top where the neck is, we generally say they're the cervical, the very top, and then the main part of the spine is going to be the thoracic. Lower back is going to be lumbar, hence lumbar support chairs and things. And then you've got sacral at the very, very sort of the tail of the spine, as people call it. So if we talk about one of these words, C's, T's, L's, and S's, we're talking about different sections of that spine.
Yeah.
So when we're talking about the non-cervical portion of that spine, what kind of range of motion? So for example, one thing that people will always know of is how far can you bend forward?
Yeah.
Can you reach your toes?
That's it.
What would you expect in that kind of range of motion there?
In ages or just in general? Like
so if you give us what a 20-year-old and an 80-year-old would be an average amount of forward movement, contraction, flexion, then the viewers can kind of have a rough idea.
So from my amount of treatments I've done for like the 20-year-olds, I like to see where they can touch the toes, and then also touch on the floor as well, if that's possible. Yeah. But then sometimes the hamstring gets involved. That's another thing. Right. But it should be able to touch your toes
with straight legs.
With straight legs, with straight legs, definitely, 100%. But touching your toes is really important. It goes to show that your facet joints can be able to bend forward, your fascia joint's going to be able to open up as well. But if I see there's a bit of restriction, I'll be like, okay, where is that coming from? Is that coming from your thoracic, or is it coming from your lumbar generally? So that's another thing. And then also your hamstring. So it's the fact that, is there any problems coming from these muscle groups as well as coming from the actual
joints
as well? But generally, they should be able to touch their toes.
And I guess the exception would just be if the proportions of someone means their legs are longer. You take that into account, but as an average, that's about it.
An average, that should be it.
What about much older? Let's say 60, 70, 80, whatever age.
Yeah, and funny enough, I actually seen a lot of them be able to touch their toes, you know?
Really?
Yeah, it's quite strange. And I'm like, why is that? But then I'm always look at how they bend forward, and I'm like, okay, so they really do lean forward. And
so the feet are on the ground, but the legs are kind of coming forward as well, like that, right?
So I've noticed that. So there's a lot of stiffness. That's what I'm seeing. So I'm like, okay, they're finding other ways to bend forward.
Okay.
So it's quite interesting how the body works in that.
Almost like accessory muscles.
Yeah, that's it. So they really use different muscle groups.
Yeah.
But I definitely stress, like, when it becomes a position where they need to bend forward or even extend back.
Yeah.
And the muscle's not being used, and they're just using any other muscle groups, it's a necessity to get them released as much as possible, because it's your range of motion you really want. You want to keep that, maintain, increase it. Because it's longevity. That's what it really is. It really is longevity. So flexing forward, able to touch your toes is a must. That is really good. But they do say, some people say, I mean, the surgeons spoke to me, was it earlier this year, they don't like where if they have a slip disc or anything at certain ages, they don't want them to bend forward too much. There's a lot of force through the disc as well for certain people. But the younger generation should be okay. Be a bit more of a give of the disc. But bending forward at a certain age where the disc is dry,
it's not going to help.
Yeah, sometimes
in fact, just for this whole episode, when we talk about what we expect in terms of muscle, joint, range of motion, flexibility, we're not talking about 100% of the population. The exceptions exist. So, you know,
there's different meaning behind this.
It should go without saying, but I'm sure some people won't figure that out. So the exceptions do exist for everything we're talking about. So that's going forward. What about backwards in the spine? What about extension, thoracic extension? How far would you expect to go in that?
Thoracic extension, I should say, be able to see a nice open chest.
Okay.
So that should be a good range of motion. And then also your lumbar shouldn't be getting involved with the thoracic extension. It should be chest coming up, and then be able to come back a little bit. So where you can actually feel the chest coming forward and up towards the ceiling. That's where it should be. If your lumbar is getting involved, that's where the chest just stops.
Right.
So with like age 20 plus, I do see a little bit of restriction. I'm guessing because of office work and other things. But generally, it's quite stiff sometimes. That's why I give them the cat-cow to open and close, and really focus on that thoracic movement. And try to eliminate the lower back for the lumbar just for that moment. And focus on the thoracic to open up the rib cage, open up the spine, and really get that full range of motion in the actual thoracic. People have a different range of motion in their thoracic. Not everyone's the same. So
in a good way or bad way, or indifferent?
Indifferent, because some people might have a little bit of some weakness in the muscle groups on the left or the right. So that's another thing that gets involved. But a lot of people tend to have a good range of motion through this. A lot of people get a restricted thoracic at the age of maybe around 40, because they tend to not really move that chest that much. And then another point is when they get to like 70, I do see there's not much movement on the thoracic at all. Maybe a lumbar area, the lower back, but the thoracic is just stiff.
Like all one big unit.
Really, like from T1 just at the base of the neck down to T12 where the end of the ribs are. That gets restricted. Rotation, extension, especially. It's just like, oh, can you do some extension for me? And they really
they can't do it.
They go all the way. I'm just like, no. Just move this segment here, and they're like, oh, okay. How do I do that? I'm like, right.
I mean, to be honest, it's so odd to hear you say that, because that happens in so much. I'm going to speak about a cosmetic context for a second.
Okay.
Just to show you that what you've just said there is so universal in different parts of the body.
Yeah.
I've got patients who are constantly frowning like this. So they've got lines here. And I'm like, okay, so what I want, I'm going to examine your face. Just relax everything for me. They're like, okay. And they don't know they're constantly contracted.
Yeah.
That is they're relaxed.
That's it.
They've got no idea.
Yeah.
I'm like, just relax your forehead. Okay. No, relax it. Yeah, I have. And then I show them the mirror and they're like, oh yeah. And they have got no idea. And it goes, it's a bit like what you just said. They don't know that.
No, they don't know.
They've lost that range because it's so chronic.
Yeah.
And bit by bit, year by year.
Yeah.
You can't know
so true. That's a good point, you know. Yeah. That's a good point.
I see it all the time.
I can imagine. Yeah. Was thinking like, what's going on here?
I know. And I see these people going through life sometimes where they've got a face with an expression that is, you know, she'll say it's not inviting. And you know, if it was me many years ago, like, God, they must be miserable.
Yeah.
And now I look at them and I think, maybe they're not miserable. They just have no idea that's their face.
There's an angry face, but exactly. Person. That is so true. Yeah, it is literally, that is a great example. Example, because a lot of people don't know what's actually happening in the actual body when they're walking. When
they don't know what's normal anymore.
No, they're not in the actual body. They're just doing what they ever have to do right in front of them, and that's it. They don't see what's going through. So it's really good when they have the mirror.
Yeah,
that's the best thing to show them. Like,
100%.
You know, you're slouching a type of way when you're walking.
Yeah.
Your spine is kind of rotated to a certain degree. Why is that? And then when you see it, you're like, oh, let me try and fix that. The best one is when I'm like, oh, okay, I'm just gonna do a quick test and check your posture. Once I say posture, they're doing this, they're shifting, they're doing this. I'm just like, hey, just relax, it's all right, man. I'm just like, don't worry. Once I say posture, they're literally just like opening up the chest, relax the shoulders. They're trying to do.
But someone says, right, you're going on a catwalk.
Yeah, and they're like, oh yeah, all right, cool. But it's just like that's why I try not to say it as much now, because I realize once I'm just going to check your posture, everything changes. But if I just keep them like, okay, well, let me just do a quick test on some other things, and then they're still in that same position, like, perfect, great, I've got you where I want you. I want to see how you're doing. Let's try and bend forward. Let's try and rotate. Let's try and do this extension of the spine.
Yeah.
And you can get you know that mentally they're not kind of like on a defensive position.
They're being themselves.
They're being themselves. Yeah. And usually the best way is just to build up a rapport with them.
Yeah.
Because when you're building up rapport, you're getting the best of themselves at that time.
100%.
And they're comfortable.
100%.
Yeah.
So we've looked at the front, we've looked at extension. Could you talk to me about the tilt of the spine and also trunk rotation?
Trunk rotation. Yeah.
What would be the averages for both of those types of movements?
So it varies, but rotation, or the thoracic rotation, should have a good degree of around 30.
30 degrees, okay.
So you're around 30. Because once you
could probably do about 45, a bit more.
Yeah, that's it. Because remember, when you're doing rotation, you're not rotating from the lumbar at all.
Mid spine.
Yeah, so sometimes you can get like if you have like a needle coming out your sternum or your chest, which is the area of the chest, you can literally have like a needle that's coming through, and that's all you can basically do. You can get a little bit more, but if you're starting to turn this whole lower back, then you're using your lumbar muscle groups as well. So it's very, very minimal, but you can get some range out there. But once you start to rotate a certain amount more, the lower back muscle, the joints, other joints start to get involved.
I guess in that, if people are going to try this at home, as they look down to see how far they can turn their needle, they've got to keep their hips facing forward.
That's it. Yeah.
Otherwise, your whole body is just
it starts to use your glutes are going to get lifted up and everything. Yeah. So you really want just
hips forward.
Yeah, hips forward, and then you just want to get that thoracic rotation through. So it's really important to get that rotation, because that helps with just moving the joints of the spine as well, because the joints of the actual thoracic can rotate a little bit as well, and pull you through left and right, the rotaries, as they call them. Yeah, that helps you rotate.
Okay.
They're very deep muscle groups of the spine near the transverse process.
And then what about hips forward, facing forward?
Yeah, side flexion.
So,
yes, side flexion is really good. It's really important as well. A lot of people just stay in one static position where there's a lot of load. But opening up the facet joints is really important. So the range on that, it varies as well. But if I'm correct, it's around the thoracic one is around 20 to 30 5, if I'm correct.
Yeah.
And yeah, you just want you basically, when you're doing it, you don't want to go all the way, because that's not thoracic.
Okay.
It's literally thoracic and lumbar. You're
Yeah.
stretching the whole area. So it ranges to just opening up from here.
Okay.
You're just coming across. So yeah, it's open and closed motion.
Fine.
And that helps with basically your rib cage as well.
Yeah.
So there's another thing you got to think about. Your rib cage is opening up.
Yeah.
Once you go past that range, you start to stretch the lower back muscles.
Okay.
So yeah, thoracic and side flexion is really, really important.
Yeah. And what about moving down the spine? How do you judge range of motion for the lumbar, the lower portion of spine? What kind of test can you do to see that?
So you can do your anterior pelvic tilt as well. You see how restricted that is. So your pelvis is this. If you can open and close that tilt, so you open and close in the posterior and anterior tilt. You can see how far that range can go. If there's stiffness, then what tends to happen when you're doing a posterior tilt or an anterior tilt, so when you bring your pelvis this way, if it can't, then there's some stiffness through the actual muscle groups as well. Right. So you got to work into those areas. There's another one where cat-cow is another one. You can see how far your flexion can go in the lumbar. Yeah. There's another one where you're checking your rotation, how far you can go into the full rotation of your lower back. Yeah. And then there's also a extension of the actual lumbar as well, where you see how far you can go back. If there's
the full back.
Yeah, that's it. Okay. Yeah, the full back. That's a really good one.
Do you need people standing up for that? I'm guessing.
Yeah, you can have them standing up or sitting down.
Oh, it doesn't matter.
I prefer, to be honest, I prefer them sitting down.
Okay.
Because you're locking the pelvis down as well.
Okay.
So for example, you're locking the pelvis down when you're sitting down. Yeah. And then you can just hold their sacrum a little bit and then just guide them back.
So you're pushing the very very base of their spine.
Just holding. Yeah. You just hold.
And then you want them to lean back.
Yeah, just lean
beyond
back.
Your hand.
Yeah. So when I have them leaning back and by themselves first.
Yeah.
And if they can go further than the range, okay, fair enough. Okay. But if they can't, and say for example, they're here. Yeah. And then I'm right behind them and I'm saying, go back a bit, and they can go here. I'm like, okay, what's going on here? Right. But if they can go back all the way through, and I'm seeing a little bit of a curve in the lower back, I'm like, okay, that's perfect. But if they can't, then I try and help them guide it through. Okay. If there's any resistance or anything, I'm like, okay. Some of those areas are a bit stiff. Yeah. And remember, it varies on different people.
I was just saying,
it varies.
I wouldn't expect the lumbar spine to have a huge amount, definitely not as much as the thoracic.
Definitely
very slight.
It's small. It's very small. It's very small, but you can see the curvature of the lumbar, where kind of you see a little bit of a curve when they're coming back, or even like a dimple or like a crease. When I'm seeing a crease, it's quite nice.
In the skin, you mean?
In the skin. Yeah. Sorry, in the skin. Yeah. So it's a good range of okay, there's some range of motion there. They're not using other thoracic or areas of the joints to get that extension. Yeah. Yeah. So it's good. It's really good.
And then we have the very, very, very base of the spine called the sacral discs, S1 to S5.
That's it.
They're much, much smaller, obviously, because it's a very, very small area. And I guess if we want to talk in the animal kingdom, that's generally where the actual tail
is off,
hence why we call it the tail of the spine. Yeah. I have no idea the answer to this. Is it even worth checking the range of motion in that area?
So to be honest, that area is very, so most of the time osteopaths, for me, I send them to the osteopaths or to the chiropractors, only because those areas are very, very, very small. I still work in them. Yeah. But then you got to get the muscles that are involved in, like the glutes. So I release the glutes a lot. But when it comes to those areas, you've got a lot of things that are like the nervous system. You've got like the
very delicate area.
Very, very delicate area. So you've got to be careful working in those areas. I had a couple of patients with that area with like inflammation in that area before. But the range of motion on there is quite restricted. Yeah, not getting that much in that area, but you should be able to move it. Okay, if you can't, then we have to say, look, maybe I want to see maybe an osteopath as well, just to check how far your range of motion is in that area.
But I would guess the range of motion of the inner cervical is going to be the most, thoracic the less, lumbar less, and sacral the least.
Yeah, that's it. That's it. Yeah.
And then so range of motion. That's one you said. That's one of the things you check in the sort of spinal MOT, if you like. Another thing you said was strength resistance.
Yes.
Could you give me an idea of what kind of tests you do to check that in someone's spine?
Okay, so we've done the cervical one-way resistant. So for example, I'll say again, so if you're doing a side tilt, I'll press down on this side of your head
And to put
and you
against
just
your
resist. Yeah.
Okay.
If you can't resist that, I'm not going to put like 100% where I'm breaking your neck, but just basically holding where if you can't resist and you're getting pain, then I'll be like, okay, that's a positive. I mean, so jot that down and say, look, okay, there's got weakness on this left side of side flexion. Let's see how the left rotation is. And if they look to the left, I'm pushing down from the forehead or the side of the forehead, and they can't, then that's another positive. And that could be, okay, they've got weakness in muscle groups, into maybe the joints as well. There might be a bit of weakness or inflammation around that area. And then also another thing is strength training or strengthening the muscles of the neck. It has to be very specific as well, because it's a
what do you mean by that?
So when I'm saying strength training, it could be resistance of a band, using a band.
Specifically just for the neck?
Yes, sometimes because some people have a little bit of weakness through the joints as well. It depends on their age. So a lot of people that might have surgery from before, I have to be like, okay, look, I can't give you certain exercises because you had surgery on it. I'm going to refer you to an osteopath or refer you to a chiropractor, because they may give you the best exercises for that. But when it comes to certain strength exercises, the muscles are quite small. And also it's a really important, it's really important to give them the right and correct exercises for that, for those muscles.
Okay.
Because you could be using the wrong muscles in that area. So the extension, I'll just have them looking up and I'll be pushing down gently. If they can't, then okay, that's another positive. If they can, that's great. Flexion, holding from here when they're looking down and trying to push up as much as I can from a different angle. And that's the one for thoracic. It's when they rotation, I usually kind of like push them to one side gently.
So you're pushing on their back to see if they'll push against you as you rotate.
That's it. Yeah. You can do it from the front as well. If they're just holding their hands, you just press down on the elbow. So they're pushing the elbow and see if there's any, just a light pressure or resistance. And if you're seeing any restriction or weakness, then you're like, okay, let's strengthen these muscle groups. So and extension and flexion is the same. You just pressing on their back.
And then when people do the cat-cow, so they're on their 6-point touch on the floor, so they got their hands, knees, and toes, and they do that. Do you put any resistance on that as well to see?
No, none at all. None at all. Because it was seen into different movement of the facet joints. I like to see like, okay, where's the restriction coming from? I had many patients where they do the cat-cow, and it's only their pelvis moving, if that. I'm like, okay, where's your spine?
Right.
And then I'm like, this is when I try and get them on the mirror so they can see what they're doing, or record them. That's the best one to do. I'm like, okay, this is what you're looking like. And then I show them a video, or show when I'm doing it, and then they say, okay, can we do that again? I'm like, okay, sure, let's do it again. And they see, okay, I understand. I'm like, do you feel what I'm doing to you?
The spine is basically one big thing like that.
And it has different movements, so it can move a little bit. It has a bit of fluidity to it as well, like a nice fluidity to it. So it's really important for them to understand the movement of the spine. Because a lot of people are just sitting down most of the time and just really static. So it's really important to move.
They forget what's normal.
They forget what's normal. They forget. So showing them is better than just telling them. I always say
it's very difficult to appreciate, I think.
Definitely. So I'm really happy when you show them it and they see it and they kind of understand and they do it themselves. Like, oh, I get what you mean now. This is how it's supposed to feel. So it's really nice. I even like the open book exercise where you're really opening up the thoracic. So you have them behind hands behind the head, elbows touching, and then you're on the floor one side, and you're opening up all the way through, and then you're just really touching the other side of the floor with your elbow. That will help open up the thoracic, a little bit of the lumbar as well. It's really, really good exercise. So I have that, or give that to a lot of my patients that are restricted.
So in terms of strength resistance, that sounds to me a very, very simple test. You're simply getting them to do the same exercises such as range of motion, but you're just putting your hand there. And that's literally all it is.
That's all.
So what's the difference between testing and another thing you said you look for when you're doing a general spine MOT is, by the way, MOT, if you're not in the UK, it's like a thing we do for our car every 2 years to make sure it's roadworthy. So when I say MOT, I mean like a check, if you like. So what's the difference between checking the range of motion and active range of motion? What does that mean?
So the active range of motion is where I'm moving you through that range.
So you're helping them actually complete the range of motion.
And then also, the active range of motion, I've seen how far you can go. And then, by yourself. And then the resisted one, is that the one you was asking for, the resisted?
So you said one thing you check is range of motion and also active range of motion.
So the active range of motion is when you're going by yourself, and then the other one I'm helping you as well.
It's just,
I'm guiding you all the way through. And then the one I'm seeing by yourself is the way I want to see how far you can go. And if I'm saying, let me see how far I can go with you. And then I'm like, you can go extra 5 degrees more.
Fine.
Then I'll be like, I'll write it down, I'll draw it down and saying, look, this is how far you can go. And this is how far you can go by yourself. And this is how far you can go with me helping you.
And so when you do these tests, let's say there's some positives or negatives in terms of range of motion, active range of motion, as well as the resistance to the movements. How do you as a clinician work out whether that's a problem of joints and or soft tissues?
So it's sometimes quite hard to find these out. This is why we do these tests. So when we're doing not just for the spine itself, but just like even for the hip as well. If there's restriction through, say for example, we're doing 90s tests where they're laying down on their back, one leg up. They try to extend their leg as much as they possibly can. One leg down, one leg up.
See how far back they can go.
See how far back they go. If they can't go past 70, we do say around 70 because a lot of people can't get to 90. 70 range of motion, then I'm like, there's some restriction through the hamstring, through the hip flexors. Because sometimes the knee is not fully extended, it's like kind of half bent. So that's another thing. It's like, hamstrings are tight, lower back could be tight as well, hip flexors could be tight. Which is the hip flexors, like a psoas area. And then also, where else is that coming from? Is that coming from the spine? Is that coming from the fascial chain? So it's very hard, but then we just point it down to, this is the muscle groups that's been used here. And these are the actual, these are the joints that's being used here as well. So for example, the hip is another thing that we have to look into. And then also when it's another joint getting involved, like maybe the sacrum's getting lifted or rotated a little bit when they're doing the 90s test. What can we do here? Let me send them to somebody else that is focused on that area. But then when it's muscle groups, then that's my time to shine, where I'm releasing some of those muscle groups of the hamstring, release some of the muscle groups of the hip flexors as well, so we can get a full extension, and also releasing the calf as well, because that's another factor in there. If I'm, say for example, they did a nice test and they only can go 60 degrees.
I'm like, if the legs are flat on the floor, just for the people watching, so you lie completely flat on your back.
That's right.
If my hands here represent both of my legs, keep one like that. I want to see how far. 90 degrees means I can get one leg straight like that. 60 degrees is probably about there.
That's right.
If that's all I can do, is probably an issue.
That's it. And then if that's the case, then I do a little bit of resistance. So I'll do.
So you're pushing the leg down as you ask them to push up.
I'm pushing up towards.
Oh, you're helping them complete range of motion.
So I want to push that up. And at the same time, they're pushing me down. And this is where we start to do something called MET, which is muscle energy technique, or PRI, which is another technique from the MET subcategory. So basically, it's proprioceptive reciprocal inhibition. So it's basically shortening and lengthening the muscle at the same time, letting the nervous system kind of activate and send information to the muscle groups. And that will help try to lengthen the tissue a little bit. If that doesn't help, we got to release those muscles. So I do that during the massage sometimes, to lengthen the tissue and then see how far we can go. There's usually a good little bit of results because the tissue is nice and lengthened throughout the session. But it is really, really important. If you're getting a decrease in your hamstring when you do the nice, then where else is that? Where else are you getting that movement? It most likely is from the spine. So if your hamstrings are tight, where the muscle usually says, where we're going to go next to get some range of motion, usually from the pelvis, the hip, or the spine. So this is why it's good to lengthen those muscle groups surrounding the spine, because the spine is its own unit, and also the pelvis is its own unit, but they work in unison as well. But then the muscles surrounding it could be restricted. So
and they're all connected.
They're all connected
with each other. So I guess with all those things, within the space of 5 minutes, you've got a rough idea of like a score out of 100, if you like, how well your spine is doing and all these things.
Yeah.
You then say, right, well, you've got a load of these soft tissues need a bit of work, and these joints potentially need to work.
Yeah.
I'll take care of this.
Yeah.
And then you need to see someone for this.
Yeah.
And only together, I guess, you get the proper full
Yeah.
potential of what you can achieve with those things.
Definitely.
And then I guess there's always exercises at home that are unique to that individual.
Yeah, 100%, definitely.
Well.
I mean, like, I always say, look, once you release these muscle groups, it's best to maintain and lengthen them, especially at a certain age as well. Say, for example, elderly, they do exercises, but they're still stiff.
Yeah.
And they need some work done around their, their hamstrings, their lower back. I'll say, okay, cool. This is what you're doing. This is what you need to lengthen. But these are the exercises that you need to do to maintain that.
Okay.
For a lifetime, really. I mean, you don't have to do it religiously, but just maintain it. This will help with your movement, and also maybe seeing a osteopath or someone.
Yeah.
It depends on their actual health of the joints as well.
Okay.
But yeah, movement is key. This is what I'm saying. Movement is key, because you might have a tight short muscle that I've released, and then you go back to your day and day, working, sitting down,
and you just reverse
and then you just go back. Yeah. So we help release those muscle groups, and then it make you acknowledge that, okay, I need to work on this.
Yeah.
And then you just maintain it. That's all. Yeah. Because tissue just shortens and contracts. It contracts and lengthens. That's it. That's all it does. So you just need to maintain that, and also relax the nervous system as much as you possibly can as well. But yeah, it's very, very important for strengthening those muscle groups as much as you possibly can, and then also making sure your spinal health is really good as well.
Yeah.
Try and get into those range of motion.
Yeah.
So it's really hard to, maybe I can't fully open up.
Yeah.
Let me focus on that. I mean, I've been sitting at a desk for like 8-10 hours. I know it's hard, but just try and open up a bit. Just to get that range of motion.
I guess people don't, well, I might be wrong on this, but I guess some people will come to you thinking, right, I've got this problem. I'm going to go see Ramone. He's going to do this. And maybe the osteopath is going to do that. And then that's it, done. They don't realize actually the diagnosis means he's the cause of that. I don't know, desk job all the time or something, no activity or something like that. And yes, we can help that.
Yeah.
But it's actually down to you to stay that way.
That's right. Yeah.
So it's 50% you, 50% them.
That's right. Yeah.
You're all now and they're all in the future.
That's right. Right. I mean, like I always say to them, look, you can come and see me to do some work, and of course, massaging and releasing some of the tissue is great. But I say, look, most of the work is not here. It's at home, or is that like when you leave work, or when you train, you got to focus on these things at home, because it's like if you're working, 8 hours a day on a desk, then you do that for like maybe 2-3 years, and you start to see a change in your posture.
Yeah.
Then you come see me.
Yeah.
Get treated, and then you're thinking, oh, can this get sorted in a week? I'm like, oh. I know I'm working on you, but it's not going to happen like that.
Yeah,
it might feel good, which is good, but it takes a time. It takes time. Like if you think you're doing 8 hours a day for about 2 to 3 years, and then you think in 1 week we can do this and change your posture, man, that my hands must be bloody strong. But no, it's the fact that you have to do this over time. You really got to work on yourself and like take your time and do it. These things take time because your body is a structural biomechanic
puzzle piece.
Yeah,
right. It's
really
a lot of pieces put together.
Yeah, you really got to focus on getting back to full range of motion.
Yeah.
Once you have full range of motion, it means that you can use your full strength on that muscle group.
Yeah.
So, for example, if you can only go from here to here, and the muscle's supposed to go here to here all the way through, that means you only got this much strength.
Yeah.
It depends on the bodybuilder. Some bodybuilders, I mean, like powerlifters, might need that power just from that short burst. Yeah. But usually for the average, you should be having a full range of motion and then the full amount of strength in that range of motion. So you use that muscle group properly.
Yeah.
Yeah. So when there's weaknesses, that's when there's a dysfunction. And with a dysfunction, you have lots of problems.
Yeah.
So when they say, can you fix this? I'm like, look, it takes time.
Yeah, it's a chronic problem.
It's
a chronic treatment.
That's it
as well.
If it's very acute, it's okay. But when it comes to chronic, it's like, okay, we need to work on this, and pronto, we can. Yeah, definitely.
And one specific thing I wanted to ask about the spine, I think this is something which, even if you're not an expert, even if someone is not doing your job, we can very easily spot this particular issue, which I'm going to say, which technical term you will know as kyphoid.
Yeah.
And I would like you first to explain to our layman viewers kyphoidosis is,
Yeah.
what causes it, and how you generally tend to go about treating someone with it.
Of the spine?
Yeah.
Yeah. So usually, when we say kyphoid, as in kyphotic curvature of the spine.
Yeah.
So usually the thoracic area is getting enclosed in. So on the anterior side of the disc, they're getting pulled forward.
Yeah.
And it's closing in and compressing on the discs
Yeah.
sometimes. So that causes a lot of problems through the disc and a lot of load through the actual disc as well. I'm not sure how many newtons go through there, but it's just a lot of load. And that tends, I mean, I've got a couple of patients from the office as well that have had that, and they still got that as well. So the best thing they can do is manage it, because it's come to the point of like, we can't open that up as much because it's chronic now. It's stiff. It's
right. So there's a point where you can't actually.
I can't. No, definitely not.
Right.
No. You can basically reverse a little bit of it.
Yeah.
But it's more of the muscles tightened up over time. And then all they can do is try to focus on mobility and open up as much as they can, because it's a joint fusion as well sometimes as well.
So it's hard and soft tissue.
Yeah. Because it's the joints, it's the muscles that stiffen around it.
Yeah.
I mean, if you want to get surgery, then that's another thing.
And just a quick pause for those that don't know what we're talking about. Probably should have said this first. When Ramone's saying the discs in the spine are kind of rotated forward a bit, you add that up over all the discs. It's the people that walk around like this.
That's right.
They've got that sort of hunchback.
Hunchback.
That's the layman way of describing it. They're like this.
Yeah.
And you see it sometimes really quite markedly in older patients.
I mean, I saw it today.
Yeah.
When I was coming.
They lose inches of height.
Yeah.
Right.
There's so much load through the disc, and then also there's inflammation on the joints. That's another thing. Affects the nervous system.
Yeah.
It can affect the hormones as well.
Yeah.
Because there's a lot of compression on the actual disc and then on the nerves, sending signals to every other areas of the body. I mean, if you got your nerves that connect to your organs as well, so it affects your hormones. And then you also got the head that's coming forward.
Yeah.
Because when you get in that kyphotic curvature, you're rounding, then naturally your head has to follow.
Yeah.
And then that usually comes down and
down,
and you're looking down and you're coming forward. So that's more pressure through than the cervical area. Cervical area, and then also through the thoracic area as well.
Yeah.
And then if you want, you can sit down, and that's more load.
Yeah, exactly.
Yeah. So it's the fact that these muscles they have to do something, so they tighten around it.
Right. Why do they tighten? Is it just a protection mechanism?
Yeah, it's a protection mechanism, and also it's a way of the muscle. The muscles follow the joints. That's why it has to go somewhere. So the force of the muscles have to go around the joints. So if the joint is going left, the muscles go left. If the joints go right, the muscles go right. Vice versa, by the way, vice versa. But if you're always in that position, those muscles will just get either shortened, weak, or lengthened and overworked, depending on those areas. But yeah, when you have kyphotic curvature, those muscles get overworked, and then you stay in that position.
Yeah.
And some people have a condition of that. When they're born, they might have that. But generally, on a day-to-day basis, people have that because of their posture and where they're sitting down.
And they've just done it over such a long period of time.
Yeah. And then they come and see me, for example, and say, do you think we can reverse this? I'm like, it's possible to open it up a little bit, but to reverse the whole thing, that's going to take time. And I don't think that's possible for like a full extension if you can't, if you want it done in a year's time, or
even a year.
It depends if it's that excessive where it's just coming forward. We need to focus on foam rolling. We need to focus on staying into a nice extension every day. It's like a religious thing you got to do.
It's just, it's kind of, if you've got that to a severe extent, you're talking about an entire lifestyle change.
Yeah, you've got to change
to treat that.
Yeah.
Not a number of visits.
No.
An entire lifestyle change.
That's right. It's not just come to clinic and then just get the deep tissue work and then also some increased range of motion work. It's do come to the clinic once in a while, but then most of the time you're working on yourself. Or find a PT or someone or a personal trainer that knows how to get you into that extension. Because I can't come to you tonight 24/7. Wake up, let's do this, and you got to do it. Even if it's 5 minutes every hour or two, or 10 minutes every hour. You're really opening up, trying to focus on opening up. Especially if you're at work, it's going to be hard. You're naturally just working, but just working into open up the actual thoracic and also the spine that is restricted, then it's then you'll see some results.
And-
But if it's really excessive, then it's harder.
Okay.
The more it's in, like the more forward you are, it's harder to open up.
Yeah. And I guess the more forward you are, the more of your hard and soft tissue combinations have just got more work to do.
That's it.
It's a hack. So for someone who is in the early stages of the kyphotic curvature, but they don't quite realize it. But if you were to look as a professional, you would be able to tell you're on that path.
Majority of the time, yes. Yeah.
What kind of signs or tests can people at home do to check if they are tending towards this issue?
Usually the best ones is the actual scapula. So the wings,
Shoulder
the bones.
bones,
Yes, those ones, your scapula kind of goes forward. That's a good sign.
You're kind of going like this, almost.
That's a good sign.
Yeah, you're closing in.
Yeah, shoulders rolling forward a little bit as well. Head posture as well as another one. Another test is to do where they are basically trying to retract the scapula back, and they can't squeeze the scapula.
Like as if you're trying to put a tennis ball in the middle of your spine and squeezing it with your shoulder blade.
If you can't really squeeze your scapulas together and you're getting a bit of weakness there and you can't hold that, then I'm like, okay, we need to strengthen those muscles in the back, because the scapula is not doing its job. It's not holding you in position where you can come back. It's keeping you open. And usually the test is the chest is really tight as well, where you're getting a lot of tightness in the chest. Yeah, where everything's contracted through.
Okay.
So those are the signs as well. And also range of motion again. Range of motion. If you can't get a nice thoracic opening or a chest opening.
Extension like that.
Yep.
Like an eagle.
That's it. That's it.
Yeah.
That's it. If you can't get that, then that's another sign. There's many tests you can do.
Yeah.
But it's just seeing if you can do these range of motions, and if you can do them, then that's a good sign that you're okay. But if you can't, then we need to work
back in and let's
do some work. Yeah.
I think those are good things, because those are things people can easily do at home.
That's it.
While watching this, in fact, and
that's it.
Just check for themselves.
That's right.
So let's pretend someone has a kyphotic curvature to whatever extent.
Okay.
And we know that they've accepted this is a lifestyle change now. Whether they've got it or whether they want to prevent it as well.
Yeah.
It's something you do have to think about in your life, the way you train, the way you live, etc. In your job, perhaps. Let's say someone has got a desk job.
Okay.
And you mentioned earlier that it may be something where if you're being treated for it, maybe once an hour, you've got to spend a couple of minutes doing something. Let's pretend people watching this, they are in that boat, or maybe they're not in that boat, but they're happy to do those sorts of things.
Definitely.
Sure.
100%.
What kind of exercises are you talking about for the person to do who's at a desk job once an hour for a couple of minutes?
Okay, so the best one I would definitely say is wall angel. So wall angel is basically you go to the wall. You can do it on the floor as well. You go to the wall, head on the wall, stood up. Sorry. Yep. Head on the wall, back on the wall, feet a little bit forward.
Yeah.
Bum on the wall as well.
Yeah.
And you're just basically trying to get back of your arms on the wall, even the wrist as well.
Yeah.
And you're just sliding all the way up. And you're just touching your hands all the way down.
Dumbbell-less shoulder press.
That's it. Yeah. And you're just coming all the way up, all the way down. Just as long as your arms are extended, you want your arms to be extended, because that's when the wings, the scapula, is getting its full rotation of the full external rotation as well. So you're opening all the way up and all the way down. You're just sliding up and down, basically. And then that will be really good for your range of motion of your scapula, the back, and that'll open you up as well.
And how many times, how long for, how many sets?
You can do it for like a minute or two.
Okay.
You can do 30 reps. You just do that daily. You just do it daily to really open up, because a lot of people, they can't, maybe if they're doing it, I tend to see their head go forward first.
Oh, okay, right.
And I'm like, bring your head back, touch the wall of your head. Then I say, if they can't do that, I say, go on the floor, get a mat, lay down on the floor, and just do the same thing.
Yeah.
You can bring your knees up if you want, and just but because you're just focusing on this. What
if their curvature is actually, they have curvature and they're not doing this prevention, and they are a little bit forward, but they can only get the lower half of their back against the wall because of that curvature, and they can't bring their arms back. What happens then?
Then you just got to keep maintaining it.
Just do what you can.
Yeah, just do what you can. You'll start to see yourself opening up. And then there's another one. You can do your cat cow. Those are really good, because you're open, but focus on the thoracic.
Okay.
You want to focus on not just the lumbar. You want to focus on the thoracic opening. That'll be really good. You can do the open book one I was saying before, where you're laying down on your side on the floor, your elbow. Knees up. That's it. Yeah.
Recovery position.
That's it. And then you're just opening up your arms, closing, and then the other arm is touching the other side.
Your knees are still
Yeah,
touch.
you don't want to rotate the knees.
Okay.
You can even have one arm touching your leg
Okay.
across, so you're not really moving your legs
like
as
that.
much.
And then you basically just go around like
That's
this.
it. And you're just doing that about 30 times.
Okay.
Nice and slow.
Yeah.
Focus on your breathing as well. That will help.
Okay.
And then even like scapular push-ups as well.
Yeah.
So you just focus on the scapular movement.
Okay.
Just up and down. A lot of people bend their elbows, and you're not really supposed to bend. You're just literally doing scapular movement.
Okay.
You're not really doing the push-up. You're literally on the floor.
Yeah.
Movement on the scapula. Arm straight, and that's it. You can do it on the wall as well.
Okay.
A lot of people start to bend their elbows, and that's where it starts to activate your trapezius a lot.
Okay.
It starts to activate.
And they tighten up.
Yeah. So this is a sign of like you're using other muscle groups more than the actual muscle groups that you're supposed to be using.
Yeah.
These will help with the thoracic. This will help with the kyphotic curvature.
Yeah.
And then some, of course, like when you're doing your wall angels are the best ones because it's super easy. Anyone can do them.
Okay.
Not anyone, but they can get into that position a bit more easier than normal.
Yeah.
Another one is basically broomstick behind your head and bring it back and up and down. You can do it lay on the floor, so you're facing down.
Like a Smith machine.
Yeah, like a Smith machine.
Like
yeah.
just with the broom. Yeah. With no weight.
That's it, with no weight. Even a band, you can use a band if you want as well, like a resistance band, sorry.
Yeah.
You can be laying on the floor and then the band coming behind your head and
Yeah.
coming back up and down.
Okay.
That will really help with the scapular strength and then bring your spine back a little bit and strengthen the muscles surrounding it.
If you're using a resistance band, I'm guessing you want one where it's not pulling your arms. You don't want to use strength to maintain it.
No, yeah.
Nice and loose.
Nice and loose. Just a little bit of resistance. Nothing where you're going to
Sure.
a point where you're shaking.
Yeah.
Yeah, that's when you're getting a bit more better at those things.
It's fun.
Yeah, but really and truly, it's just to give a little bit of resistance and a bit of a sign of, okay, I know it's there.
Yeah.
Yeah, those are the really good.
And there's no such, all the exercises you mentioned there's no such thing as a best one.
No,
Okay.
definitely not.
Whatever you're capable of doing.
100%. This is why when it comes to some people like different ages,
Yeah.
It depends on what they can do and what they can't do. If they had an injury that has stopped, a chronic injury, I should say, then I'll be like, okay, if we can't work on these areas for now, let's try and find a different exercise that will help with your range of motion.
Yeah.
And then they'll be like, okay, cool, let's do that. And they usually are happy because they can actually still move in that range of motion and it's not putting pressure on that injury or that injury is not occurring again. So so there's different.
So they can graduate then to the
That's
next
it,
most difficult one.
And they feel happy because they actually seen results as well. Of course, over time, but it's a nice thing to see because you're seeing them increasing the range of motion.
Yeah.
You're seeing them coming out of like a depression stage because I've seen that many times. Yeah. And I'm like, okay, look, they're looking much more better. They sound much better and they're happier because they're like, oh, look, I can do this more.
Yeah.
And I was like, yeah, good. Keep doing it, please.
You know what? That is a really good point because I mentioned at the start of this podcast, we talk about all the typical things of aging, the way we look and disease, blah, blah, blah. But actually, what you just said there, they're happier.
Yeah, 100%.
Why would you want to get older or live as long as possible if you're not happy?
Yeah.
And this is why this is so crucial as well.
100%.
And so we've got, some of the early signs. We've got some exercises people can do at work or at home. I think what you mentioned is, obviously what kyphotic curvature is and how we can manipulate that soft tissue. But I think we should also talk about something you mentioned earlier, which is the muscular weakness. And I guess there is an element of at least relative muscular weakness in a kyphotic patient. Because if, let's say, they are a bodybuilder, as an example, or I see this, I was a DJ for many years, so
nice.
I might know.
I didn't know that.
But I saw many security workers in nightclubs to try and look intimidating. They would only work the front. They would work their chest and their biceps. And then they'd all walk around like this. Yeah. And even I, with no experience in sports massage or osteopathy, can look at them and go, they're screwed in 50 years' time. Yeah. So if they are, if they have the muscular weakness or they're in that kind of job or bodybuilding and it's because they've just overworked.
That's it.
Can you give me an idea of what kind of gym exercise people can do to increase the strength of the antagonistic side
definitely.
of that?
So I'll definitely say, for me anyway, because I love doing pull-ups. Yeah. Pull-ups are really good, especially if you're doing them correctly as well.
Can we talk about that? Let's say someone has a kyphotic posture. I know there's lots of different grip and pull-up
ways. Yeah.
There's assistance where your knees can be on that pad that they pull you up. Yeah. Because there's so many different types of pull-ups. Can you give us an idea for this particular type of patient, the kyphotic patient? Yeah. how would you recommend they go about the pull-ups? And if there's different kinds for different ranges of the kyphosis, please go for it.
I mean, the best one to start off with is like basically, you're basically having, instead of actually going on the bar itself, you can have like the squat bar. Use a squat bar.
Yeah.
And you're just having the actual bar itself, and you're literally putting yourself up.
Okay.
But your legs are diagonal. You're in diagonal. You're hanging.
So when you let go and your arms are extended, if you were to take a picture and put it that way around, it would look like you're in a push-up position.
That's right. So you're looking up into the ceiling. You're literally like this. Your whole body is like diagonal, and your heels are touching the floor, not your toes, and you're literally just coming up.
Yeah.
And then slowly coming back down. You can't, if it's hard, then you just focus on the assisted pull-ups. You're just coming up. You're just feeling the motion of that scapula moving. Yeah. And you're trying to focus on the chest, pointing towards the actual pull-up. Okay. Pull-up bar. You just
so if you're using a bar, you want to actually open up like that. Yeah. So the bar's almost coming here.
That's it. So this is why I always think like using the actual squat rack and trying to focus on your chest touching the actual bar is better.
Like a reverse bench press.
That's it, because you're really focusing on scapular retraction. Yeah. So bringing the scapula back, squeezing your scapula towards your spine, and then opening your chest at the same time. Yeah. And you're trying to not overuse your traps when you're doing it. Because a lot of people just bring the traps up.
Yeah. And not even realizing.
Yeah, without realizing when you're doing a pull-up. So you're really focusing on retraction of the scapula, bringing your scapula back towards your spine, and on the full range, and then touching your chest to the bar at the same time. And you can use the assisted machine as well, the assisted pull-up machine, because then you can forget about the weight and just bring yourself up and focus on the full movement. Yeah. So it's not all about the actual strength, it's all about the full range of motion. Yeah. That's when you actually get a full contraction of the muscle groups, and the muscle will get strengthened, the spine of the muscle will get strengthened as well.
And what's, because we've got lots of different types of grips. You can go like that. Yeah. You can go like this.
That's it.
You can go at an angle. Yeah. What do you recommend?
I think the basic one is fine. Just
a straight horizontal grip.
Straight horizontal one, or any one that can get your full range of motion of your scapula. Fine. If you can't do the pull-up, then do rows. Rows are quite nice. You're just rowing forward and back. You can use a row machine, or you can just use actual cable resistance machine. You're just pulling, trying to do face pulls basically towards your face. You're squeezing the scapula and then opening up and closing. Those are really good. Yeah. Like I said before, scapula push-ups. Yeah. Cat-cow's really good. Yeah. Thread the needle as well is a really good one. You're basically on all fours, all sixes, 6 point, and you're literally going through your hand is going through the other arm. Okay. And then you're going up, and then you're opening up all the way through. That'll open up the thoracic.
And when you do that particular exercise, if you're on the floor like this, and you try and lean, as you then open up like that, your hips, are they still parallel to the floor, or are your hips turning as well?
Sometimes you can have the hips turning, but it's the main thing is open up the thoracic. It's just opening up the whole way through. If you want to turn your hips, you can, but some people do, some people don't. It's just really opening up the actual scapula and try and get that opening of the chest as well. That's the main key thing, to open up the chest and then getting this contraction of the scapula as well. Those are the key options, because all you want to do is movement. It's just the movement of that area. If I'm starting to see you're flinging yourself, then I'm like, no, stop. Because it makes no sense you doing it, because you're opening up way too much. Yeah. Where your whole hip is getting moved across the floor. Yeah. You just want nice control through the whole movement. That's all.
So when you're doing these, let's say you're doing row exercises or face pulls. Yeah. The one I'm currently doing at the minute, after speaking to you for a while, is I'm getting cable machines and I'm going like that. Yeah. As well.
Those are good.
Can you give us the names of, in those exercises, the names of the muscle groups that we're specifically trying to target in order to oppose or reverse to some extent?
Yeah. So thread the needle will be serratus anterior. So the muscle groups over here, they're for contraction, but you want to lengthen those as well. Okay. And then when you're doing your lats, pull-ups, you're doing the lats, you're doing the muscles of the back. So you've got your rhomboids as well. Yeah. Rhomboids major and minor. So they're the muscles between your scapula and your spine. Okay. And they go up towards your neck as well. Yeah. And then also
they're like a sort of diamond shape, like that in this
lovely muscle group. Yeah. A lot of people don't work on those though. That's the thing. And then also when you're doing cat-cow, you're doing the muscles of the rectus spinae that go from your lower back all the way up into your neck as well. Okay.
So you're like long ropes almost.
That's it. Yeah. If you look at bodybuilders as well, you can see the muscle fibers of the back. So if you look like Ronnie Coleman, basically, he's got a lot of a Christmas tree, basically. So it looks like a serrated Christmas tree if you look at the back. But yeah, rectus spinae is the lower back all the way up to neck, like a rope. And it's literally extension and flexion. That's what it usually focuses on, mainly extension, to be honest.
Yeah.
But it's just the cat-cow helps with that one. That was really, really, really good.
Yeah.
I mean, you can do your Romanian extensions as well.
Okay.
Those are quite nice.
What's that one?
So it's a machine where you're laying facing down in diagonal. So you're basically upright, but you're diagonal, and you're literally focusing on your back movement. So you're like on a hinge. You're literally going up and down like that. Yeah. But what you want to do is not try to get all the way down, touching the floor. Okay. You just want to focus on a little bit of flexion and then come all the way up. And then try and get that nice extension of the spine. Don't lock all the way through, but just get the feel of the muscle group. Okay. And then you're coming back down again and then back up. Try not to of course, flex all the way through, because that's a lot of load through the lower part of your spine. Right. But you want to get a nice flexion where you feel it, and then you're coming all the way up, nice and slow. Okay. And you're just focusing on the actual movement than anything else. No way, you don't need to use weight. Yeah. For now, anyway. You just, if you've got a lot of excessive kyphotic curvature, you're just trying to focus on coming up and then opening up your chest and coming back down, and that will really help. You feel the movement. Yeah. When you're doing it. So do about as much as you can. Yeah. Don't tire yourself out, but just focus on the movement. Get the feel. Okay. You want to get the feel of it.
You're not trying to build strength. You're trying to make sure you're maintaining that range of motion.
Yeah. Yeah. You're trying to increase, maintain and increase. That's what you want. You don't want to be lifting heavy weight to be able to get range of motion. You want movement. You want the tissue to be, you want the tissue to be moved. Yeah. The joints to be moved as well. Another good one is, I'm trying to remember the name. It's a cable rotation from the thoracic.
Okay, like that.
Yeah, you're just doing that. You're just literally coming from this position to this position.
You see people that want to be pro golfers actually tend to do that quite a lot, don't they?
That's it.
Fall like this, try and work on their trunk and the
sweat. That's it. That will help with, and you can go on your knees if you want, you go on the floor. So you're just eliminating the other muscle groups. Yeah. And you're just focusing on that nice movement as well.
Why is it, let's say you're standing here, you've got, my hips are facing you, I've got the cable here, and I'm going like this. Why does that help oppose a kyphotic curvature?
Because you're working, it's your abdominal muscle groups as well. They come up to the top of the rib cage. So a lot of people, when they get in kyphotic curvature, all this muscle is getting not used as well, and then it's sitting into that position. So it's something called transverse abdominis that comes across. Yeah, that is a muscle group that gets overused and weakened because you're just compressing down. Okay, so it's coming up to the top of your rib cage, but it's still getting affected because you have you're putting a lot of load through that. So you want to really focus on that rotation as well. Yeah, and also remember, when you're doing the rotation, you're working on the thoracic as well, because it will help. Because remember, you're only in flexion. There's no more rotation left.
I see.
The muscles are just weak or lengthened or even shortened, and they're weak, and you're just in kyphotic curvature. Yeah. And then the muscles that are trying to rotate, they can't really rotate as much anymore.
So, we've gone through quite a few exercises there to try and help a kyphotic curvature.
Yeah, 100%.
So people watching this, how do they know which one or which ones to use?
I think you should just use all of them, because at the end of the day, you got to get full range of motion at each angle as much as you possibly can. Increase your range of motion. If you've got a curvature where you feel like, oh, I can't open up my chest as much, then you start opening up your chest with some exercises that will help with that. And then also check your range of motion, your left and right, and see how you're doing. Because usually when you get a curvature like that, the facet joints get locked into place, especially if it's excessive. So you won't get much range of motion anymore. Right. It's only get a limited amount naturally. But if you can't even fully rotate your thoracic, then you're like, okay, I need to work in this. So test yourself and see how you're doing. Yeah. Or you can just see how, when you're doing those exercises or those movements, see how far you can go. Okay. If you feel like you can't go any further, then it's best to do some of those exercises and try to open up those muscle groups. And if, of course, your facet joint is locked and you don't know it, then maybe see an osteopath or see somebody that specializes in those areas, which is important.
And if people are doing these exercises, how long before they start to notice even a minor positive change?
Oh, that varies. That definitely varies. So some people might feel it in the next month or two. Some people might feel it in a couple weeks. Maybe in 6 months. So it does vary.
That's a big range.
Yeah, because it's chronic. Sometimes it could be chronic, it could be subacute or acute. But it definitely varies. I can't put a number on it because
it depends on the individual.
It depends on the individual.
Fine.
I mean, I've done a couple of ones where it took them 7 months, and I was like, oh, okay, it was very slow. but then after a while it started to increase.
Yeah.
And I was thinking, is it because they haven't done nothing at home?
Yeah, possibly.
That's what I was saying.
Yeah,
So it's hard. It's really hard.
Yeah.
But it varies. It could be like 7 months of, okay, they got nice extension.
Yeah.
And then after that, it maintained. But then there's somewhere it's like 4 months. I'm like, okay, nice. It's really well done. Well done. Keep going. Keep going. So yeah, it really varies on different people. I've got someone right now where I've treated them for a whole year, but they haven't done other exercises.
Right.
It's like, okay.
It's a very limited sort of even treatment.
Yeah.
For that.
Yeah. I mean, the muscles are nice and warmed up for that on that time where they're like, oh, okay, I've got a nice window to work through.
Yeah.
And then they don't do it. I'm like, okay, this is not good. I guess
Yeah.
because they're busy, but then I'm seeing them again and again. I'm like, ooh, this is not looking good.
Yeah.
Yeah. Let's really focus on this. But yeah,
and emphasize the fact that it's a team effort.
Yeah, 100%. Yeah.
It's like going to the dentist, you know, you can get a clean twice a year.
Yeah.
But there's just literally no point in going if 364 days of the year you don't brush your teeth.
Oh, there we go. Yeah.
It's a waste of time.
Exactly.
And that's one of the reasons I left dentistry. I couldn't bother to do it anymore. Yeah.
Oh man, that must be
manic. I mean, when I got tired of that, I moved into the cosmetic side anyway.
Okay.
Because they're motivated patients.
Yeah.
You know, cosmetics treatment is optional, right? It's not essential.
That's right.
Whereas brushing is essential.
Yeah.
And if people aren't doing the essential, I can't do anything.
Yeah.
Apart from tell them to brush their teeth. So I just got bored.
Oh my God.
And then I went to cosmetic and they're motivated. They listen. You know, they're happy. If they can come for cosmetic.
Yeah.
But even if they had general dental health issues, like they weren't brushing properly, if I told them how to, they would just do it. And my work would last. And I could, you know, say, look, this is going to last years and years.
Yeah.
And if they don't do your home exercises, they're wasting their time.
Yeah, exactly.
There's just no point.
It's quite hard because I mean, like not the general public, but the people that we see, you're seeing them with results, good results.
Yeah.
But then there's some that have had this problem for a very long time. And I guess it's a lot of because of their mental, it might be their mental state. They might be busy. They might have so many things. And I'm just like, oh, I really want you to get better. I really want you to get better. Just try and do these exercises and see how you feel.
Yeah.
Don't just do them for 2 weeks.
Yeah.
Keep doing them.
Yeah.
Because your lifestyle is work. You're always sitting down. You're always like restricted or you're always like limited. I understand, but try and do it. You see maybe in the next 3 months, you might see a positive effect where you can open up a bit more. And these are the people that have a lot of restriction. Like they can't really move. They're just stuck. Yeah. It's not the people that, you know, that actually got a good range of motion or average range of motion. It's the ones that are really, really restricted and they're feeling low. Like that's the ones I'm trying to like, look, we need to work into this because it's super important for you, for your lifestyle. For your lifestyle.
Your whole quality of life.
Yeah, definitely. So I really stress that it's really, really important.
And I want to ask you about, you know, we've looked at all the different aspects of the spine, different ranges of motion, things like that. What should the shape of the spine be? I know it sounds like a very basic question, but I don't think most people know. So, and there obviously is going to be a minor variation too.
Yeah. So naturally, that it should be a nice S shape.
Okay.
Of the spine, not a full on S, but like a nice subtle S shape where got a little bit of lordosis in the cervical.
What's that?
So lordosis is the reverse of kyphosis, so it's the other way. So instead of going curved into a C shape, it's a nice opposite of the C. So you're getting a little bit of nice curvature, not too excessive though, because that's when it gets excessive, that's more load.
Okay.
So the weight is distributed through. So lordosis in the cervical, and then also a little bit of kyphotic curvature through the thoracic, and then the same again. It just follows through. Yeah. So you're getting a load all the way through the whole of the spine as well. Lordosis in actual lumbar as well, just a little bit as well, because the load needs to transfer through the whole spine.
So how do people at home watching this know if their S shape is too exaggerated?
Oh yes, so you can check in the mirror. Okay, I think the best side view. You can check the side view. If you're seeing there's a lot of like a hump through here, or if you're getting like a more excessive lordosis, where your chest is up and there's a dent through your back where you're thinking, okay, that's strange. Some people are born with those things as well, but generally you should have a nice straight line. So if you're looking from the side view, you should have a nice straight line and a little bit of curvature on the lower back. If sometimes people have a flat back as well. Flat lower back, I should say, sorry, where it's just a flat back and then the glute comes out a little bit.
Okay.
And
it sticks out a little bit.
Yeah. And that tends to say like, look, we've got a lot of load through this area, and the best way to do it is strengthen the muscle groups around those areas to support that chain.
Sure.
But yeah, usually you should have a nice S shape, where it's not too excessive on any other angle, or convex or concave on every area.
So the best way to check is visually,
and of course go to the clinic if you feel like you might get a postural check as well. Those are really good. So you can see like the osteopath for spinal health, those are really good, or chiropractor for spinal health as well. So those two will be a really good way to check. And also of course your range of motion, try and touch your toes to see if you can, try and extend back. If there's any pain, then come and see the osteopath or the chiropractor as well. But generally you should be able to rotate, you should be able to tilt, you should be able to touch your toes. You shouldn't see any of course, unless there's a defect, of course, but you should be able to see that, okay, there's no excessive points of where I'm getting hunched over, or I've got like a dimple in my chest where I'm going forward, or I'm like rotated at a certain angle.
Complete a lift or a rep or something.
That's right.
Here's a question for you then. So whenever I've done, let's say, a seated row exercise in a gym in my life, what I've found, be it because of my powerlifting background, I don't know, but what I've found is, if let's say I'm doing a cable seated row on the multi-station machine, if I try and keep my back as straight as possible, I can't really actually feel a genuine contraction of the muscles in my back.
Okay, like the rhomboids and muscles of the back.
If I lean back like this, and there's from the side a much more sort of curved like that, then I can feel massive contraction all over my back. Is that normal?
That's normal. That's normal. There's different positions to be in for certain exercises. Like for when you're setting up for a pull-up, you don't just hang. You got to retract and depress the scapula first to activate those muscle groups. Then you bring yourself, because then afterwards you're just using your traps and arms to pull you up.
Exactly. That's
setting yourself up. You got to set yourself up for like certain movements. Same for deadlifts as well. Like you don't just pick it up. You really set yourself up into that position. So rows. It makes sense when you bring yourself back a bit more.
Got to lean back.
You got to lean back to activate some of the certain muscle groups, and then also the scapula needs to get pinched and brought back a bit as well.
100%.
So then you get those muscles activated and ready for that actual movement. But definitely what you're saying, it makes sense. It's just the positioning you're in. Set yourself up. Definitely.
So I think that's a lot about the spine. And I think people will now appreciate just how much it's not they're holding up to Ramone and let him press.
No. I wish it was, man. I mean, you only got one spine, so you really got to look after it. As in, like some of my the people I work with, they always say, look, it's really important for their spine to be looked after, because you only got one spine. And of course, you really want to look after as much as possible, because it's a lifetime. It's a lifetime.
100%.
It's a lifetime. I mean, I want people to feel better and actually move better as well. So that's my key thing. And of course, it's strengthening the muscle groups. And also getting full range of the muscle groups. Reducing your dysfunctions of what you can't do, to get rid of those as much as you possibly can, and then also see if we can actually get full range of motion. Of those joints and also the muscle groups as well, because there's so much restriction in certain degrees of, and that could be coming from an injury, that could be coming from a defect, lifestyle, diet as well is another thing. So those are an age. So there's so many factors. And then I'm pinpoint, okay, these are the factors. This is what I would like you to do. This is what you want as well. How can we meet to help you as well? So it's just about building that trust. And then working through those areas where you're having those problems, and then just getting rid of them as much as possibly can. I mean, you can't get rid of everything, but majority of the time you can. There's some people that have these problems for lifetimes, and it's like, okay, what can we do, and what do you want to do? I want to run a marathon. But I'm getting pain in my back. Can you help me? How much time do we have?
2 days.
2 days. Okay, let's see what we can do, But then I always say, look, let's do this, but then please come back. And let's see what else we can do. Because you might want to do a marathon next year or the year afterwards. And it's like, okay, let's see. And then they come back and then they're like, okay, let's try and do this, let's try and do that. And they're feeling a bit better. And they keep coming. And then like maybe it's like once a month or once every 3 months or
that's what I was gonna ask. Because when people talk to me about abs, what's your longevity routine? I guess I do have one. I don't realize it's a routine. It's just the way I live my life. Obviously things like diet, making sure I'm physically active, making sure I get sunshine on my skin. Nothing complicated. That's nothing that costs any money either. People expect me to say, I take this magic thing. I do take certain nutraceuticals. I do use things like NAD+. But they're useless if you don't get the basics right.
That's all right.
And for me, in my opinion, when it comes to the basics, like what you eat, your physical activity, your sunshine,
your sleep as well.
Sleep. I think making sure your joints and your soft tissues are doing well is part of the basics.
100%.
And so to that end, I want to ask you, let's pretend someone doesn't have any sort of active complaints, at least not that they're aware of. You go to the dentist, let's say twice a year on average. You might go to the gym a couple times a week. What would you say the frequency is for a sort of spinal checkup should be for the average person? Not including people with injuries or current problems like curvature. The average everyday person with no major issues.
So it varies with them because they will have to see, like, of course they will see me for spinal like movement and everything, but then also they'll see like an osteopath or chiropractor. So they got their own type of time to see them. But for when I've seen my patients, I say like come in like every 3 to 4 months to see what's been going on, or come in once a year. It varies for some people, but I would say like, look, if you're getting no pain, no injuries, but you just want to check your posture of your spine and everything, you come in like two times a year or once a year, and then just manage it. Because when you have the exercises, you can just maintain those, and that should be okay. And then like sometimes you see osteopath or chiropractor, they say like come in like once every 2 months, for example, just to double check what's going on. It's like, okay, you're fine, you're good. Right. Keep working on what you're doing, and that's if we don't need to do anything else. So it does vary. It's a big window for people, but generally people, because everyone has a different spine, everyone has a different
absolutely.
But usually it's like, oh, come in like once every 2-3 months, or come in every 1 to 6 months. It varies on the person. Maybe I'm coming once a year, which I've had before. And I'm like, you don't need to come in from now, man. You're doing really good. I've had that quite a few times. So I'm like, you're doing really well. Maintain it. Your muscles are nice. They're quite nice and strong. They're strong as well. Your movement is really good. You don't really need to come in as much, but if you want to come in for general work through your muscle groups, then come on through.
Fine. I guess it's similar to referring to when I was a dentist. Some patients I would see once every couple of months. Very, very high risk. Maybe they had learning disabilities, physical disabilities. They can't even hold a toothbrush properly.
That's it.
Clearly, they're probably going to get decay a lot easier than other people. And then people with, let's say, just dentures and no teeth. Just to check the soft tissues takes 10 seconds. I might bring them in every 2 years.
That's it.
And it's very, very varied. So I want to talk about some of the acute causes of spinal issues. You alluded to a couple of them already. You talked about bodybuilders, you talked about powerlifters and things like that.
That's it.
What are the major problems that doing things like that chronically? Obviously, if you got bad form, the bad form is the issue, but we're not talking about that. Like, even if someone has good form, and whatever good form is for that individual, what are the most common issues that being done chronically has on the spine, if any?
Compression. A lot of compression on the actual disc. Intervertebral disc. Intervertebral disc is that jelly substance between the facet joints. It's like a sandwich, basically. Like so sometimes it will come out and push forward and compress on the nerves, and then also anything like compression on the nerves sends information to the back. So a lot of people that have great form do some exercises, like for example they do squats, for example, and all that load goes heavy squats, for example. So great form, the bodybuilders did it, but then after time that weakness goes through the whole lower back generally, and saying, look, I'm getting some injuries because I had an event that came up, and I had someone actually that done they done the marathon. Then the next day they wanted to do explosive dynamic work in the gym, and boom, that was it. Back went. It was finished, and their back was fine. Their spine was fine. It was fine. They only had a little bit of problems through their legs. Literally done that. Done a run. Then they done the explosive work the next day. I don't know what they done. I don't remember. But their whole lower back just blew up. And that's because either the muscle's fatigued from the actual training and maybe the marathon on top of that, or it just went to spasm and just pulled. Then the whole lower back just flared up. So it was swollen. It couldn't move anymore. It was stuck in a certain position. I was like, okay, he was fine the other month, or like when I last saw you, but you've overtrained. You've definitely overtrained. So now the tissue is just holding that area. The nervous system saying, don't move. Now we need to free that area by doing some gentle movements and try to open up without aggravating the area. So it's there's those acute stages where it's this inflammation. Inflammation of the bursa as well, which is like, and there's basically another jelly substance between bone to bone. And then you got the nervous system that's just flared up as well and inflamed. And that sends information to the muscle saying, don't move, you're doing too much. This is so that's your acute. Sometimes that could be acute stage where
it's
sudden
overtraining. And just training to a high physical load. Chronically.
So you got like, when you're doing, sometimes there's another option where you're training high volume, high resistance, at a short period of time. And that's where high injuries come in. That's where your injuries come in. And sometimes you're acute. You could be great, you could be fine, but then you're just saying, say for example, you do like heavy lifting today, high reps, and you do that throughout the week. Boom, like, and you don't know it, but then you say, oh, okay, I'll just rest for that day, and next thing you do it again, and he's like, I've just done like one set, and now I pulled my back, and it's like, I don't understand how. It's like, what did you do last week? And it's like, done this, and it's like, oh, you put yourself into a lot of load. You haven't rested properly. And you can do these things, but if you're doing it at high volume, high resistance at a short period of time where there's no recovery, then there's a higher chance of you getting injured or acute injury. And then if you do that over time throughout the years, you just forget about it. That's when it becomes chronic. Subacute, then chronic.
I mean, I think when you're in your 20s, you've probably got the best chance of getting away with things like that.
Oh, 100%. In terms of you can jump over walls and be fine.
I look at myself now, I got into powerlifting when I was in my 20s. And I look at the way I was training. And there's no way. I'm only just into my 30s now. No way can I do that schedule.
That's it.
Even if it was my full-time job, now I physically can't.
And the thing is, you need
staggering.
It's a lot on your body. There's a lot of stress on your body. I mean, you can, if you focus on your recovery, you might kind of skip some of the injuries, but it was more higher chance of you getting injuries as well. So it's like, you really, if you're going to be doing these things, you really have to have a recovery period. And this is why massage is really good. So a lot of athletes get these massages because they need to day-to-day basis.
You got no choice almost.
You got no choice unless you want to push yourself and try and see without. But majority, like, look at footballers, they have like massages like nearly every day. After training or you know, so massages, physios, you know, mental health is another thing that's coming in. And then also looking after their diet as well. So if they're doing extreme training, they need extreme recovery.
Fuel themselves.
They have to, The muscles going through a lot of tension. The nerve system going through a lot of tension every day. If they're not getting enough sleep, there's another problem. So imagine you've done a lot of training, you've done a lot of resistance, you didn't get much sleep, and then you're going back. And it's like, it's
too much.
It's too much on the body. It's too much on the body. So you got to be really, really careful. Even if you're young, you still you might skip those injuries, but when you get to that certain age where the muscle is fatigued, take a break.
You have
to take a break. Take a little.
I mean, I used to train probably about 6 times a week, 6 days a week at my peak. I had no issue. And I was absolutely fine. I'll do it perform well. You know, I don't know, some people want numbers, but my biggest deadlift was 251 kilos.
That's amazing, man.
Just managed a quarter of a ton.
Yeah, that's cool.
And when I pulled 251 kilos, I think I weighed, roughly speaking, 71.5 or 72 kilos. So it's pretty decent.
That's decent. Well, that's amazing.
I mean, I probably would have been in the top 10 in the world if I was in the World Championship.
I was about to say.
Which is pretty good. I mentioned this guy's name because I was just watching some of his old videos. I still got a lot of love for the guy, a lot of respect. But Andy Bolton, who considered one of the greatest powerlifters to have ever existed. He's the guy who first ever pulled 1,000 pounds. Which is, I think, 465 kilos. And for those that don't know, when you see strongman like Eddie Hall and Thor or Bjornsson, they're lifting strongman deadlift. The bar can be a little bit different. And also they can slide it up their knees. They can go up and down. In powerlifting, you can't do any of that. Strict. You can't even have straps.
So it's really strict.
Yeah, really, really strict.
Wow.
It's the hardest type of deadlift, really. And you can't slide it. It's got to be one clean movement.
Oh, right. Yes.
And that's it.
Yeah.
And all you can use is chalk. And that's all. And Andy lifted 465 kilos, 1,000 pounds in a powerlifting style. So he's considered by many the greatest deadlifter ever. And I mention it because I was so privileged and lucky to be his training partner for a number of years, which is where I did all that. And I look at that now and I think, if I was seeing someone like you, would I have been able to lift a lot more? And I personally, I can't prove it, but I think I probably could have.
You're right. You might be able to, actually.
I was pulling those weights with niggles all over my body. And if I didn't have those, potentially done a lot better.
Yeah, definitely. I mean, like you're working into muscle groups. I mean, we've got pre-event and post-event. I'm not too sure if I spoke about it before, but we've got like the pre-event work where we're doing like effleurage, and a bit of petrissage work. So effleurage is just light strokes gliding through
along the length
of the muscle, and then petrissage is like against the muscle where we're rolling and kneading through the tissue across the muscle, and that's where we're maybe loosening up some of that scar tissue, some of those basic restrictions in the muscle groups, and then lengthening the tissue as much as possible so we can get the full range of motion. So if maybe we could have helped you.
100%. I mean, there was a guy, I'll give him a shout out here. There were two guys I saw at the time. One is Dan Stott, who's now working in Dubai. Big shout out to Dan. And Jan Adamowski, who was similar in your jobs, massage. Phenomenal guys, and really so glad to have met them. I still see Dan now and again. Good man. And I had them to count on.
That's it.
And I think a lot of people don't realize, how should I integrate my, really intense training schedule, sports schedule, whatever it may be, with seeing someone like you. Should they come see you immediately after the gym? Should they plan it so that they only come see you on the day off? Is there seeing you too much? Et cetera, et cetera. So how do we think about it?
I would say, like, if there's someone that does, like, say for example 7 days of training, and I'm like,
which I don't recommend, by the way, just for the record.
It's like, I'm done. No, but like if it's like 7 days of training, I'll be like, okay, come on in. For example, I'll find out what's their schedule. I'll be like, okay, cool, coming in these days. So for example, I'll say coming in two days a week, and come on the recovery days. I don't know what your recovery days are for those 7 days, but coming in those days so we can actually say for them, I just do just a little bit of running on the Tuesday and the Thursday, but the rest is like heavy lifting. Like, okay, come on those Tuesdays and Thursdays where you're just doing a little bit of running, and we'll just work on some effleurage work and some petrissage work. And I'm like, okay, cool. But if it's someone that does like training 3 days a week, goes to work, I'm like, look, come in maybe once every 2 weeks to see how it is, depending on their situation. So it does vary on the person, but someone that is training quite a lot, I say come on in more often.
Like every week, something like that?
Yeah, every week.
And there's no issue with working into that muscle every week?
No.
Okay.
Once a week is good. If you're overtraining your muscle group, you want to lengthen the muscle group as much as you possibly can. I mean, it depends. If it's so short, where the muscle's so really tight and short, it's like, I can't get no full range of motion. I need to use this muscle nearly every day. Come on in.
Okay.
Get loosened up a bit to kind of, because it might be so much restriction because you're using it so much. And I'll say, look, you might have to cut it down a bit and just work on it for a week. See how it feels, and then go back into your training regime and see. Because if you overuse the muscle, it's just going to be fatigued all the way through. So I'll be like, I've had some with the bicep. They had a bicep tear, partial bicep tear on the actual distal point. So they was feeling really weak on that from jiu-jitsu. And I was like, look, take 2 weeks off, because I already seen him and he wasn't getting no improvement. So take 2 weeks off of jiu-jitsu. Come and see me twice a week for I think it was twice a week for I think 2 months. And then he's like, within the 2 weeks, he's already getting better. He said he had full range, and then also he can actually do a bicep curl with a dumbbell as well. He couldn't do it before. Once you get over here, he's like, he drops it down straight away, and he's like, no, I can't do it. So once he'd done that, I was like, good. I was like, don't do any locks. Don't do anything in jiu-jitsu like that's crazy. You can do a little bit of locks with the legs and stuff, but don't do anything with the arm.
Yeah.
Please just don't do anything. It's like, okay, you didn't do anything. And then a couple months later, it was fine. He had full range of motion, and he could do a bit of resistance as well.
Yeah.
And he said he wants to lock, but he's a bit skeptical about it. And I was like, okay, just don't do it for now and just strengthen. And then after a couple more months, 6 months later, he was able to do back to normal. Yeah, it went back to normal. So that was a good sign of he needed rest. Okay, he needs to work into those areas.
So you can even go multiple times a week, and it's not a problem. It's
individual. Unless the area is that damaged, I'm like, look, just take a break.
Don't do anything.
Don't do anything. Don't do anything.
What kind of damage are you talking about?
Yeah.
Where you say, right, don't do anything.
So say, for example, they strained their tendon or the Achilles tendon, for example, on that day. I usually say try not to come in straight away.
Okay.
Because there's a lot of inflammation on the area, and I might be doing more damage than good.
Okay.
So I'll be like, okay, depending on that area, I'll say, look, ice, reduce inflammation, coming tomorrow. But a lot of people just come straight away.
Yeah.
So I'm like, look, this is what we want to do. We want to keep this light. We don't want to do nothing too aggressive.
Yeah.
So we just want to keep this light. I'll usually say, you shouldn't be coming in. You should be resting that area. Let the blood just flow out, and then also let the ice do some of the reducing of the inflammation. Then come in the next day and we can do some work through that area.
Right.
Yeah. Those are like the options for recovery, for the best recovery as well.
So if someone's torn something or a suspected tear, be it connective tissue, be it a muscle in the gym, sporting event or whatever, what would your advice be in the immediate period? Like it's just happened 30 seconds ago. What's the best and worst thing that they can do to help themselves at that moment?
So I had someone who had I think it was Achilles, like half of the Achilles was torn, but I couldn't tell at the time. So I was limping. I was like, what's going on? I'd done tests. They couldn't do the test. I was like, go straight away to A&E. I said, go straight to A&E, get a scan, get an MRI scan, and see what's going on. I came back and there was nearly a total tear. Wow. So the best thing to do, go to A&E. Yeah, because that's out of my expertise now. That's the point where it's like you need to go and see someone to focus on that. They came back, I think it was 3 to 4 months later. Yeah. And they said, it's getting a bit better. It's getting better. Yeah. I was able to kind of push off, but it was still painful. Yeah. But they got surgery, attached it back to the heel, the bone, or the foot. And it was much better, but it was still painful. Okay. Still painful. But it's, if you see something that is just like, look, you need to go and see it, I'll let you know straight away. I won't just go, oh no, let's keep working it.
Okay, fine.
Yeah.
Okay.
Yeah, I say I'll either give them to someone that is a specialist or go say, get a scan. I'm gonna refer you to get a scan straight away. Okay. MRI scan or X-ray, depending on the area. Yeah.
So, I mentioned training that I personally did, which is powerlifting. So to the people that don't go to a gym, they can't tell the difference between powerlifting, weightlifting, strongman, bodybuilding, etc. Now, just for those people, so bodybuilding is just about size. Mr. Olympia, huge guys, but they can barely lift anything. I've always been the same size in my life because I literally don't care what size I am, how I look. Yeah. But I was always the small guy in the gym who would lift twice as much as other people. And I loved that.
That's so cool. I love that. I love watching YouTube.
No one knowing what I could do. So that's just for strength. Then you got weightlifting, which isn't about strength. It's about moving a mass at speed and over your head. And then you got strongman, which is about versatility, which is about lifting awkwardly shaped things, running with it, pulling, pushing, how you can apply everything, which is why they don't look in shape. You look at a strongman competitor, you think they're just obese. Yeah. Powerlifters generally look relatively small, unless you're in the heavyweight category. And the weightlifters look very, very trim. Yeah. Like they could be fitness athletes because they look fantastic. So when you see, let's take most people I think will train for size. Yeah. So bodybuilding. That's it. And then I would guess after that, powerlifting is probably next most popular. Yeah. If we take both of those, training for size versus training for strength, what differences do you see that doing to people that come and see you, be it in the spine or in general? Yeah. Because I think in my head, and please correct me if I'm wrong, but when muscle gets really, really big, you can't move it as much. Like we've all seen prank videos of big bodybuilders where someone comes and puts a post on their back and they can't get it, can't do it. And then power lifters, you know, like I was, I think one of the big problems is probably not in your remit, but heart disease, because of the level of pressure that is.
A lot of people dies doing it.
Yeah, absolutely. I've done lifts where I've bled from, you know, my nose and things, and no one's punched me. It's just the pressure of the vessels. And obviously that's going to have an impact in terms of the hard tissues, the soft tissues. What kind of differences do you see in terms of the negative side? Between doing both of those things?
I always feel like when I'm working into weightlifters and definitely powerlifters, depending, more weightlifters. I feel like the fascia is much more tighter. Like when I'm going through, I'm gliding across, I'm feeling like, oh, I can't really get into it as much. It's really viscous.
It's rock solid.
So I can't get into it. I'm not too sure the difference between it, but I do feel like there's not much give through the area, and the muscle of the weightlifters, because I've treated quite a few really big guys as well, especially working into their lats, there's no range of motion as much. Everything's just like boom, it's just there.
It's just slabs of
it's just like, okay, let me get into that. And then I'm just like, this is it's like it's stuck. It can't be freed properly. So I feel like there's not much feedback through there. So when I'm working into it, like for example, the subscapularis, which underneath the armpit, I just can't get into there. I'm like, right, we need to actually release those areas, because that's usually a point where a lot of people don't really open up as much. There's a lot of stiffness in there. There's no movement on the joint. So like we were saying, Phil, when they really can't touch their back.
The range of motion is gone, isn't it?
It's gone, and it's because of their lifestyle and the way they lift. So usually the muscles around the spine and the joints, like the shoulder, that's the point where I'm like, I need to get into this and release it, because it's very hard, sticky, like as in like the fascia is very sticky and doesn't really want to move. So Graston tools, I use my Graston tools, which is like or gua sha as they call it, just like any material. You can just glide across the skin, and then you're basically breaking down some of that light fascia, superficial fascia, bringing it up to the surface. So your blood will come up to the surface, and you see any red pigmentation, like dark red spots, that's something called petechiae, basically blood vessels popping and breaking down. But that helps to increase the blood flow, and then also that should help loosen up the actual stickiness of the fascia at the same time, and that should increase your range of motion a little bit, and kind of loosen up some of that soft tissue at the top as well, which is really nice for some people, because some people can't take the pressure of someone's hand going into the muscle groups. But I do feel, and then for powerlifters, I mean, I treat a lot of rugby players. They've got good range of motion. I was quite surprised. Some majority of them have good range of motion, but then when I get to like the traps, that's when it stops. The traps gets very hard. It's really hard. I think that's because of all the colliding through those areas. But like the rectus spinae, that's not too bad. Then when I get into the shoulders traps, that's when it gets very stiff. It gets really, really, really stiff. But no, it depends on the lifter. But weightlifting, is dense, really dense when I'm going through. I'm just imagining it now when I remember going through some of the muscle of the rectus spinae is really, really hard and dense.
So I guess in bodybuilding, you're talking more about complete loss of range of motion, which I guess people can predict anyway, but when they're that big, they can't really move around very easily. And sometimes I guess with the thickness of that muscle, it makes your life a little bit harder, at least. You've got to work slightly differently to reach things.
Definitely.
Weightlifting, you're seeing much denser connective tissue. With not much give when you press in.
That's it. When I'm pressing into it, it just goes with my thumb, especially with my thumb and palpate through.
Like a sort of eraser that we used to rub out a pencil in school. And then in powerlifting, I guess a little bit similar to weightlifters, but maybe not as...
A little bit. I mean, there's a bit of give back. With some powerlifters, because you can feel like they've been using the muscle a bit more, but with bodybuilders, usually it's just a big sturdy block of muscle. So it's like, okay, I need to go into individual muscle and kind of really get in there and kind of loosen the area up, because it's just there. So it's just really working work in each fiber as much as I possibly can. I mean, it's really hard to get into muscle that is just blocked up. So,
So I'm going to ask you a question which bodybuilders won't like.
oh no.
But it's not a difficult question. When people get to a certain size,
Yeah.
for obvious reasons, their range of motion will go down. I think everyone would agree with that.
Mm.
On that basis, would you say the long-term implications of getting that big, and I'm talking decades down the line, if you maintain that size, would you say that that's unhealthy?
Ooh.
To lose a range of motion to the point where you can't even take a sticky note off your back?
I think that is, in my eyes, I think it depends. It depends on your lifestyle, but in a general basis of things, I think it's more important for range of motion than having big muscles, and that's it.
Yeah,
because
I agree.
I just think only because like in all of human lifestyle, it's like you mean if you was a caveman, you need to have full range of motion, chase, to run. I mean, we're living in a lifestyle now where you don't really need that as much. But I think it's really healthy to have. I really think it is, because like, you know, hip opening, you know, spinal movement, rotation of your shoulder, you know, picking up your child if you want, you know, that stuff. If you can't do those things, it's like, what would you want to do then? You're just going to be like really restricted in motions, you know, like you can't maybe, like for example, bodybuilder that can't maybe touch their back or grab something from the top of the shelf, like a cup, you know, because they're stuck in this motion, they can't do it anymore. And then you look at someone that has an injury with the same thing. It's like the same thing. You have no range of motion left. You're both in that same position where you can't grab a cup, you know? So it's like, why would you want to have that in that point of view where you can really get that full range of motion, where you can grab something, you know? It's basically, in a way, it's like dysfunction. Well, dysfunction from different sides of the view. One has got bigger muscles, but they can't get the full range. One has like normal amount of muscle, but it has an injury. So it's like you both can't grab that thing that you need to do because you can't get the full range of motion. And of course, one has it because they need that because of their lifestyle, and one can't because they injured themselves.
I mean, frankly, if you get that, if you can't reach the top shelf because of your size, in my opinion, everyone on Mr. Olympia is injecting themselves with God knows what.
Oh gosh,
because you can't get that big as a human being without performance enhancing drugs. To get that big, you probably use them, in my opinion at least. And that alone has implications. Look at Ronnie Coleman now.
Oh,
the guy is struggling. And this is why I wanted to ask you this question, because some days he's in a wheelchair. And I saw him walking up some stairs. And I really genuinely do not mean this in a disrespectful way. I'm only saying this so people get an idea if they haven't seen the clip of what it's like. But he was coming up these stairs, and it reminded me of Gollum from Lord of the Rings. Oh God, the way he was really hunched over, trying to climb up those stairs. And I think, yes, he's had a lot of back surgeries, and they didn't go as planned. So there is other elements at play. But let's be honest. Do you think, I'm pretty sure we'd all agree, he probably wouldn't have needed those back surgeries if he didn't put his back through what he put his back through.
His back through a lot of load, man.
Yeah, exactly.
It's crazy.
And so I personally feel that bodybuilding, at least to that extent, is not a healthy thing to do.
Yeah, especially on your spine, I think. I mean, that amount of weight he done is incredible. I had to give it to him. And
you know what? I'm going to pause you there. I don't think it's the weight. I think it's the frequency of the volume.
That's it,
And the reason I say that is because at my peak, I probably could have actually out-squatted him.
Really?
Yeah.
Really?
I mean, my biggest squat was 230 kilos.
So how much did you do? 400?
Pound. He was pounds.
Pounds, that's it.
So it's probably similar.
It's quite similar.
But, I weighed about the same as what I am now, only plus or minus a couple of kilos. And I'm fine. So I think it's the frequency, it's that squat in combination with all the other work we're doing every day.
You're right, Abs.
And it comes down to what we said before. You can't train every day and be healthy long term.
It's like high intensity, high load at a short period of time. When you're doing that constantly, it's just like wear and tear.
It's too much.
I think what you're saying is right. I mean, like he has put his body through a lot of load and throughout over the time. I think
for decades.
And think he didn't need, wouldn't need the surgery if he didn't do that. But I think I know which clip you're talking about now. Now I'm remembering. Is it the one in the show? Where he's getting up the, I saw that actually. Yeah.
And it was just so sad to see.
Yeah, it was sad.
Really sad. I don't think he's ever going to get his normal way of walking or range of motion or joint health back. That's gone now.
Yeah, it's got a lot. Yeah, it screws in the spine now.
Exactly.
And then also in the back and hip.
Yeah. And I think, what will be interesting for the viewers is, many people would agree, that's not healthy. The way he is now is not good for a human being.
Mm-hmm.
And we're sat here talking about there's such a thing as overtraining.
Yeah.
Whether it's this type or that type.
Yeah.
So I think a lot of people will be wondering, okay, I'm sure you go to the gym.
Yeah.
Talk to us about...
Try my best.
Talk about the frequency and the style of training and what you do. Because what you do clearly is going to be not too little, not too much.
Yeah.
Because you've got this understanding.
That's it.
I think that will be really useful to the viewer. See what does an expert do?
Yeah. So from my background, I done boxing, kickboxing. So those are my two backgrounds. I've done a lot of running when I was younger. So I just kind of used those as my basis and transferred it into the gym a little bit, where I'm doing skipping now more often for like heart health. So I really do, I love my skipping. I love skipping. It's fun. Yeah. And I started to do a little bit of cardio, but nothing too excessive for me.
Yeah. Give us an idea of what you're doing for how long.
Okay, so I do a bit of my weightlifting.
Yeah.
So say for a whole day, for the day I do an hour of running, hour of training. Yeah. So within that hour, I do maybe 20 to 30 minutes of exercising, and then warm up
with weights.
Yeah, with weights. So I warm up first. Okay. Maybe 5 to 10 minutes. And then I do my weightlifting or my shoulder health as well, because I love doing shoulder health because it's really important because of my work. Like I work style. So I work on my shoulder health, external rotation, internal rotation, some band work, and then I go from there. Then I start to do a bit of stretching, of course, for those areas. Then I get into my weights. Okay. So I do like maybe military press or shoulder press. Yeah. 3 sets, and then go from there. And then from that point, I go from a lighter load and just work into the actual biomechanics of my shoulder. Yeah. So I really focus on like the external rotation of that full range. So my thumb is literally pointing that way. So I'm not just going from here. I'm really getting to that full range of the actual shoulder joint. Yeah. And then for example, if I'm doing legs, I focus on squats. Focus on like different angles of squats as well. Single leg squats, calf raises, but different angles of calf raises. And then also, then I go into my running. Yeah. Then I do a little bit of cardio at the end, or skipping as well, or even rows. I try to use a bit more of the bike as well. Actually, that one's quite fun. I like that. But I still test things out. I still like. Yeah. I'm not lifting for muscle size or anything. I'm lifting for health and strength. Okay. That's the main and maintenance. That's it. Yeah. I mean, that's my main key thing. I'm not lifting like to make myself look big. And before I used to, I tried my best, and that used to affect my asthma. So I'm like, nah, forget that. Yeah. It's more for like longevity, cardiovascular system, and then also strength as well. So yeah, that's my basis. So it's basically warm up, exercise the muscle groups that I need to focus on. Yeah. Then I do my cardio, and then I do a bit of a cool down period as well. Okay. Like stretching and just loosening up those areas. Fine. And then one of the weeks I might do other day I might do like an explosive workout, dynamic movement.
This is within that same hour?
No, within that week. Okay, so I just have like within that week I might say, okay, let me do my dynamic workout. So, split squats movement, some wall balls, or throwing the ball on the floor, kind of getting working into my cardiovascular system, and also my kettlebell swings.
Almost like conditioning.
Yeah, just conditioning myself, just because I don't use my hips all the time because I'm always at work. So I really want to use the hips, use the hip hinge movements, because they're very powerful movements as well. But yeah, I used to do a lot of Tough Mudders as well, which I love those. Because
I hate those.
Do you?
Every school I went to as a child, I broke the 100-meter record.
Is it?
Occasionally, I broke the 200-meter record.
Yeah,
I'm done after that.
Is it? No more.
400 meters. I used to get about 2/3 of the way.
Yeah.
And then just walk off.
Right.
I tell you, I wouldn't even finish it sometimes.
Really?
I'm not can't be bothered with this. Yeah.
Oh man. I mean, I love them, man, because it's like you can do 5K, 10K, 15K. I've done three in Reading. Is it Reading? Yeah, three up in Reading.
Yeah.
And they're great. They're really fun, man.
Yeah.
They're really good. I mean, my dad used to do a lot of cross country and up in Derby as well.
Yeah.
But he doesn't do them anymore. But I think that's where I go from, the running.
Right.
It's just like a lot of endurance running. I love
I used to do cross country at school. You know, Wayne Manor.
Wayne Manor, yeah.
Christopher Nolan trilogy.
Yeah.
I literally used to do it at Wayne Manor.
Really?
Because Wayne Manor is actually Woollerton Park in Nottingham.
Yeah.
Which is where my school used to
stuff.
So I used to run around Wayne Manor.
Jesus.
At school. No wonder I saw it. I was like, wow, I've run around there.
Yeah, gosh, that must be mad.
We see it all the time, constantly.
Really?
Yeah, I know it very, very well.
Oh man, I must have tried it myself.
All the scenes in the film, I knew exactly which side it was and how you get round there. And
so you know every.
I know everywhere. Yeah. I know it very well.
Yeah. So that's like my routine usually. I might have one day I'll just focus on stretching,
like a sort of active rest day.
Yeah, just stretching and through, and just focus on my movement of my spine, my shoulders, my lower back, my hips. Because I had a lot of problems before when I was younger from my lower back, where I had issues. DDD, they call it, degenerative disc disease.
Okay.
From before, around, I think it was I was around 18, 19, 20, around that age.
Yeah.
Well, I was doing way too much load from my back.
In the gym?
In the gym. Right. In deadlifting, it was for me, but it was a wrong form. Because I was with my friends, you just kind of like ego lift, as they call it.
Yeah.
I was doing too much of that, and I stopped doing that ego lifting because it was ridiculous for me at that age. Because I was doing, it was like I said, repetitive, constantly doing it. Yeah. Like every day. I mean, but it was fun, but then I started to feel the aches and pains, and then I found out I had DDD from the rheumatologist as well.
Right.
So that's when I focused on, let me get better at my movement and strengthening. So it's been many years where I've had problems before, but then I actually understand when the patient comes in and they say, I'm like, right, let's see what's going on, So I definitely understand where they're coming from. And when they're having those pains, I'm like, okay, we can try and focus on strengthening those muscles and lengthening those muscle groups by doing this, and this, because I've been through that before. So, no, but these are the things that work in stretching, opening up the hip joints, trying to get the full range of motion, using your spine. And those are my day-to-day. So a bit of strength training and conditioning, warming up, and then do my cardio, and then cooling down. And then
your off days where you do mobility and stuff.
Yeah.
So I want to go through that a little bit. So you talk about what you do for a warm-up, and also how long you spend doing the warm-up.
So what I do for warm-up, wall angels, love my wall angels. Threaded needles are good.
Okay.
Frog pose, I love frog pose.
Okay.
Do you
I have no idea what that is.
So you're laying on, I don't like doing it in the gym too much because people think, what the hell is he doing? What's he doing there, man? So I usually find a corner, get the mat, and then you're on your stomach, but your legs are spread out.
Okay.
And you're just going forward and back. You're opening up. You're a frog pose, so you're literally like spread out like a frog, but your your knees are touching the floor. Yeah. You're like on the 4-point elbow.
Okay, so your forearms on the ground.
Yeah.
Your knees on the ground, and your mid body is going forward and back. Like that. Yeah.
Doing that, and then also you can internally, externally rotate your hip if you want to open up the hip joint. Yeah. Those are really, really good for people that don't really move, and they always sat down because they're just always in this flexion position. Yeah. Where they don't really move their hips. Yeah. So if you get into that position where you open up your hips and you bring the knees and spread your knees out, you can really get that nice in and out range of motion where you're actually internally, externally rotating your hips as well. It's really good for you, man. It's really, it's like yoga in a way. It's like you're really just opening up the joints and moving the actual muscle groups and the lower back. Yeah. Those are really good. I do it for about 10-15 minutes. Those light exercises and stretches. No, not long. 10-15 minutes, just warming up. Yeah. And then I just focus on the muscle groups that I'm working on that day. Right. So for example, if I'm working on my legs, I do a little bit of a warm up of deep squats, open up, trying to get the full range. And then I do that for 10 minutes, warm up the knees, the hip, and then also a bit of the lower back as well. Cat-cow is a really good one for that one. Okay. Baby pose, where you're really like crouching forward, rolling your back in, so you're really opening up the spine. Yeah. I do that for about 5 minutes, 2 to 5 minutes, depending on how I feel on that day, and then going to my squats on that day. Same for if I'm doing my explosive dynamic movement with the kettlebells or farmer's walk or something like that. Yeah. So I spend about 10-15 minutes naturally in that day to work in that area. And then if it's just like a recovery stretch day, I just do like a full range of stretches.
Okay. General whole body.
Yeah, general whole body, and maybe a bit of skipping on the side as well, just to.
So if you're stretching on a day where you're doing weights, here's a question for you. When you're lifting weight, you're avoiding tension.
Yeah.
In the muscle.
Yeah.
This is why I never stretched.
Yeah.
Ever.
A lot of people say the same thing.
When I was powerlifting, and I'm getting back into powerlifting now, and I never stretch. My warm-up is the lift.
The lift, yeah.
But at less weight.
Yeah.
What's your opinion on that? And what kind of stretches do you do? In fact, we'll start with that one.
Yeah.
What kind of stretches are you particularly doing? You've mentioned a couple.
Yeah.
But why do you do that on a day where you're also going to be generating tension with the muscle?
That's it, yeah. So I know for scientifically, they've been saying like when you're doing a lot of stretching, it does take some of the power sometimes from the actual muscle group.
Yeah.
But I've realized when I'm doing it myself, I feel like I'm getting the full range of motion. Like I'm getting my full range of like the shoulder, for example. So if I'm doing shoulder press, I'm trying to open up my shoulder joint. I'm really focusing on loosening up the muscle and the tension because I'm going to different ranges of motion where like, for example, dumbbell press, I'm going through maybe Arnold press as well when I'm coming through all the way through.
Yeah.
I want to make sure all my joints are being moved properly. I don't want to be in a position where my muscles are too stiff for me to move. I like to make sure I'm getting the full range of motion, even when their muscles are nice and lengthened. Because when I'm stretching, I'm lengthening my tissue and also warming them up at the same time.
Yeah.
But I don't like to work cold. I never like working cold for myself anyway. Just the fact that I feel like my tissues don't feel at their full capacity when I don't get a full range of motion. So I really like to focus on like some scapular movement and then also some stretching the muscles of the scapula, like the rhomboids, and then also trying to get my arm behind my back, open it up, really rotate on the shoulders. And I spend like 2 to 3 minutes just to warm up, just to get the tissue moving a little bit instead of just adding load onto it.
And do you do this before every weight exercise?
Yeah. So
so
for example, if I'm doing shoulders on, say if I do shoulders today, 5 to 10 minutes of just some light stretches through and then straight into shoulders.
Right.
Yeah. I won't spend like 25 minutes of stretching and just some movement, getting the blood flowing through that area and lengthening the tissue. Letting know my nervous system, I'm going through these areas. Right. So, and then I'll just go from light load to heavy load or heavy load to light load. If it depends on what I'm doing, a pyramid scheme or whatever muscle group I'm working on, or reps or repetition. But for now, I'm just doing longevity and working on the joints, joint health. Because naturally, I'm putting for my work, I have to put a lot of load through my shoulder, elbow, and it's a lot of contact. So it's load upon load upon load upon load. So I'm really focusing on longevity than anything else.
Right.
But for someone else, it could be different.
Yeah.
So yeah, I'm not lifting for heavy. I'm not lifting for loads of weight. I'm lifting for conditioning the area. So I always work on like opening up the joints as much as possible, getting blood flow through the joints as well, and also just for longevity. Yeah.
Okay. And in terms of cool down, how long do you take and what do you do?
So cool down will be like 10 minutes, 15 minutes, and it'll be just nice long stretches. So holding a position for a while, maybe 30 seconds to a minute. Less movement stuff, just more holding and stretching, and then that's all. So for example, if I'm doing lats, I'll do like a nice negative hold, just stretching the lats all the way through, and then just trying to breathe through that and lengthening the tissue of the lat as much as possible.
Okay.
Hamstring. So for example, was it last week? Yeah, it was last week. Touching my toes, just holding that area, and then just doing a little bit of bend of the knees to kind of take some of the tension off. Those are the basic movements, but just to get some movement through the hamstring and also the nervous system as well, knowing that, okay, I just need to lengthen this after a workout. If I'm fatigued, then I'm like, right, I'm just going to lay on the floor and just kind of like just do a little bit of movement through there from my joints and through the lower back as well. Right. Just because I know for a fact that my day-to-day basis is quite active.
Yeah, you're pushing into people.
I'm always pushing. I'm using my legs. I'm pushing through. I'm gliding across. I'm using my knees as well. Like I want to make sure I've got longevity even my wrist as well, like loosening up the wrist for me, for example, I need to look after them. It's these are my tools. So these are my tools as well. Like the elbows, like I really got to look after them. I'm not here to be pushing heavy load. And if I want to do that, I need to prepare myself naturally for that, because I know for a fact in a day to day, I've trained myself 3 or 4 where I've injured myself many times. So I know okay, this can happen to me. This can happen to me. I can't do this right now, but if I want to, I need to prepare myself. Because
I completely agree.
Yeah, because I've injured myself many times before. I'm not perfect.
I mean, peaking is a thing. You're going to get used to that weight.
That's right.
And you mentioned, those are your typical days where you've got like an hour of training and all that's sort of within that hour. And then you've got like an active rest day where you're not lifting weights, but you are working on your longevity of everything.
That's it.
Can you give us an idea of how long that particular day takes in terms of your routine?
Okay, as in exercise wise?
Yeah.
So it'll be the active rest day will be a walk or a nice jog. That's all, about 20 minutes.
That's it. Okay.
Max. Or skipping.
Okay.
And then afterwards I'll be doing light stretches of like opening up the hip, the spine, and also the my knees as well. My knees and also my ankles, because my ankles have been a bit stiff recently, so I've been working on to those because of the load. So I'll be doing a lot of rolling of the ankle, moving the ankle, moving up my knees, nice hip hinges without no weights, just hip hinge, kind of focus on the anterior pelvic tilt. On a wall, you can go on a wall and then you just put your bum on the wall, glide up and down. Those are really good. You can hold that in that position and then you're just kind of feeling that pull all the way through. Thread the needle again. Another one, just open up. And then baby pose as well, stretching those muscle groups. And then also just focusing on the lat pull. I love doing the negative pulls. So basically you're just hanging, negative hang. So you're just hanging, stretching the spine, getting the decompression of the spine. Some people don't like it because it feels a bit weird, but I do like it because it's a lot of decompression of the spine. Hanging for like 10 seconds and then just repeating that. And just basically helping the nervous system just relax as much as possible. I'm trying to focus on some breathing techniques actually, but I haven't focused on that yet. I'm trying to see how that is, but breathing techniques, opening up the rib cage, trying to work on your diaphragm as well. But I'm looking into that. I'm studying that right now and seeing if that affects and helps my nervous system. I'm pretty sure it does because I've been reading a bit about it. But so that's my active rest day.
Fine.
So nothing too aggressive on the joints, nothing too aggressive on the muscle groups. Just opening up the hips, spine, the lower back, the shoulders, a bit of the neck as well.
And that's proper sort of longevity planning.
You're
not trying to get bigger. You're trying to ensure literally the longevity of your joints and tissues.
That's it. I mean, if I wanted to get bigger, I could. Maybe I can put like another 1 kg, 2 kg of muscle in the next 2 years or something. But it really and truly is more for, like I said, longevity and maintenance. Maintenance is key for me, right? For now anyway. And then whenever I'm ready, I'll be changing my whole routine. But for now, it's like looking after my joints, looking after the muscle groups, try and get a full range of motion as I can in the gym, and then exercising, cardio, and that's it. And then that's it throughout the week. And then when I'm ready to, I've been doing this for about six months now. And then I'm gonna slowly change up and see how it builds up from there.
Fine.
But I've been feeling good. I've been feeling good.
Would you recommend? Obviously, this doesn't include professional bodybuilders, professional weightlifters, or whatever. But people who want to live as healthily as possible in terms of joints, range of motion, flexibility, etc., as they age. Would you recommend a day within their training split across the week dedicated to what you just said? Or is that too individual to say yes?
I think it is. But I always say to them, like, when you're in your lifetime, I would definitely say you really want to be focusing on stretching, and not stretching as a like a whole thing, but just like opening up a little bit of your muscle groups and your joints so you get the full range, because it's you want your full range to make sure you can actually do the things that you want to do. I had someone that had done gardening and they couldn't get into a full flexion because they're always like bent forward doing something. I'm like, well, maybe you should mobilize the tissue around that and start stretching it. those things, because it will help with your longevity of that spine or on that back or your knees as well. You're bending down, doing gardening, a lot of load through the knee day in, day out. So it's like you're always constantly in that position. Why don't you if you want to be in that position, why don't you work in that position, as in like loosen up that position as well, so you have more time to be in that position for a longer period of time. So it's longevity again. Like, so from my basis, I wouldn't say do the work I'm doing. I would definitely say like do something to help you with your longevity, because I do sports massage. So I work in long periods of hours in that position. I want to make sure I'm working out of that position so I can open up to be more in that position, because I might be chronically tight on my chest. I'm not lengthening my chest as much anymore because I'm in that position. Let me start stretching that muscle group and opening up so I can be in that position longer, instead of being chronically stiff and I can't push anymore because my chest is just tight, the nervous system's overworked, it's jacked up again. So yeah, it's just really opening up the area, get trigger ball, releasing the area of a ball, recovery stage. So that those are really important for the body, because the body is naturally going to be in a position where it's just always going to be shortened. So you want to lengthen it as much as well. I mean, as long as, if you can be slouching if you want on a desk, but if you can't get in your full range of motion on a day-to-day basis, that's a problem. As in, like that's a dysfunction.
So it's not necessarily let's take slouching as an example. It's not necessarily the slouching. It's the loss of the opposite.
That's it. Well, I mean, I'm slouching now, but then when I'm walking down the road, I'm not slouching like this. You know, but because we're resting, we can do that. But like, if I can't get myself into a certain position of extension or flexion, then I'm like, okay, what's going on here, man? I need to work into this, because this is not right. For the body to be able to be in that position for that whole time. And I don't want it to be in that position the whole time. But if I'm on the desk and I'm like, okay, I'm slouching a little bit, that's fine. But if I'm like, oh God, I need to really open it up and try to move that area. Because if you're in a position where you're just erected all day like this, you're gonna start to feel all tightness all the way through. So your body,
even the opposite of slouching is good.
So you need to have a balance. So it's a homeostasis, as they call it. But you need to have a balance of like, okay, I can get into this range of motion when I want to, not when I don't want to. It's just the fact that you need to have full range of motion as much as you possibly can on a day-to-day basis. And this is why I'm saying like recovery is really key for people that are having issues as well. Like, you need to maintain stretching. You need to maintain a little bit of stretching to loosen up the muscle, because it's always contracted. So you want to kind of open up and stretch it so you get the full range of motion of the joint. That's the key thing. That's the key thing.
And from the perspective of longevity, for people watching, some people may be watching this and realize they have a little bit of compression in that spine. If they were to dedicate a day in their training, or maybe the day anyway, even if they're not training, to doing things like this, what kind of things can they do for decompression? You mentioned one thing, which is that simply hanging.
Hanging
is that probably the best one?
There's the pull-up bar where you just hang off the bar and you just kind of like slowly decompress. You might feel like a nice decompression. You've got the one where you're off a couch, half of your body's off the couch, so half of the torso is off the couch. And you can literally just hang and just kind of stretch there. The pelvis is on the head of the couch, or the side of the couch, and you're literally just hanging.
And your body is just hanging off the back of it.
So you're laying on your stomach and you're just literally hanging off. That will stretch the lower lumbar spine for you as well.
So your hips and below are on the couch. And then this is off the edge of the couch.
That's it.
Leaning down.
Or you can go to the gym and use the Ramone extension machine. And you just hang down.
But then will that not cause compression on the anterior portion, the front portion of the disc?
That's the thing. If you've got problems, then don't do it.
Of course.
Don't do it. But if you can just hang on there. But when I was saying before, when you're doing exercises, when you're just going up and down, that's a lot on the disc where you're just constantly just compressing. If you're nice and slow, you're coming down, you're just hanging. It's not that much pressure as much as going up and down, repetitively straining that area of the disc. But if you can just hang down and you've got no issues, it's not too bad. You're just stretching the disc slightly. You're doing it nice and slow. You're not putting too much load through the disc. But you're not putting it into a point where you're just repetitively compressing the disc all the time. Because it's like a jerk movement. You're just going like that, hitting the disc all the time on that anterior area of the disc. So you can hang on there and stretch the lower back. You know, you can really get a nice stretch in there. I think the pull-up one's the best one. You can really decompress the spine all the way through. All the way through.
You're going to have an even decompression on all different sides of that disc. Instead of the back opening up because you're leaning forward.
This is it. Yeah, this is the reason why I like the hang one, where you're just hanging on the pull-up bar and you're just getting a nice stretch all the way through. You can even have like a box underneath your feet just to catch you, just in case.
Yeah.
Especially if you're like an elderly person or something, you can really have something there. I think those are the best stretches for the disc. Anyway.
Yeah.
I don't know. There's other ones, but that for decompression, that's what I know. That is a really good one. That's safe, and you're not really hurting yourself too much.
Fine.
Yeah, those are really good.
Yeah.
Those are the best ones, I think.
And then in terms of how long they should hold that hang for, or maybe how often?
So I'll say maybe 5, 10, 15, 20, 30 seconds is fine. A minute, I don't know. I think that's pushing it too much. If you want, you can, but I'll say like 30 seconds of 3 sets.
Yeah.
If it feels really good, just keep them going, but don't go to over the top, but just like 30 seconds, 40 seconds, 20 seconds, 10 seconds, and just focus on that decompression a little bit. Yeah.
What about decompression? You know, when you're holding a bar like this and you're hanging, you know, your shoulder is clearly the highest point in terms of where you're connected to the bar. What is you want to decompress above the shoulder? What if you want to decompress this area?
That's a difficult one. For my view, I have no clue how to decompress that area.
Okay.
I mean, I've seen many videos where they do the Y strap, but
and they pull it.
Yeah. But from my perspective, decompressing that area is for me, I don't know how to do that. But for the lower back to thoracic, and then maybe C7, C6, you may get a nice decompression from there. Maybe C6, but T1 all the way through, you get a nice, get a nice stretch. You where you can actually feel a little bit of decompression through the load, because most of the time, the highest amount of load is in the lower back. Because of the facet trends are much more bigger. They take most of the...
Oh, are they? Right. They've got more surface area.
There's more surface area. Like a little bit more, but is bigger than the thoracic and also the cervical.
It's kind of like the foundations of the building. They've got to be massive for everything else.
Yeah, it has to be. That's why it takes all the load. So when you're feeling it, you're mainly feeling it in the lower back. And gradually you're coming up a little bit. And you feel the pull coming all the way through. But yeah, cervical, I'm not too sure of that one yet.
No worries. And then the sacral. So the very, very, very tail of the spine, where you've got much smaller and much more delicate discs. When you're hanging, are they actually stretching out as well?
A little bit, just a little bit.
Okay.
Not too much, but just a little bit. But the tailbone, not as much. You're just getting a little bit of a pull, like a decompression through that area. Just a small.
Because it's not under a huge amount of load anyway, because it's an angle a little bit.
That's it. Yeah, the load is coming off elsewhere. So you're getting a little bit of a decompression through that area. People that have like sciatica or true sciatica, where it's coming from both legs, nerve flossing is the best one for them.
Okay. Could you describe to people what nerve flossing means?
So nerve flossing is basically you're moving the joints, you're moving the nerve through the joint action. So say for example, the sciatica's coming through both legs, down the hamstring, from the back, down the hamstring, and down through the calf into your feet, in the tingling sensation as well, and it's sharp and electricity. That's the sensation you're getting. You'll be wanting to bend the knee and extend the knee, and at the same time move the ankle. So you're not really working on muscle. You're not working on a stretch here. You don't want to be stretching, because stretching causes more impingement and pulling of the nerve. Right. So you want to be flossing, where you're bending the knee and then also moving the ankle simultaneously. And that will help move the nerve in a flossing action. Okay. So say for example, my radial nerve is coming through here. I'm feeling sensation through my neck. I will be doing a flossing technique when I'm doing this. And I'm bringing my head out to this side. And then I'm going like a teacup pose, where you're doing this. You're basically doing this all the way through. So you see how, if this is my nerve, it's being stretched out and then back. And you can do different variations where you're like this and you're coming this way. So you're shortening nerve one side and you're lengthening nerve the other way. Okay. And that will help with the flossing technique. That's what we call flossing, nerve flossing. So you're not pulling the nerve where it's getting impinged. You're flossing the nerve where it's getting short on one side and lengthen the other side. And that will help move the nerve and take some of the impingement off the nerve as well, from either a muscle, injury, or anything like that. So yeah, it really does help. Give people monocle tests where they try to bring their fingers on the eye when they try and do that.
Yes, if you have all the nerve entrapment, that's a very nice.
That's a really good one. I had a builder who couldn't do that for 4 weeks. Couldn't, yes, do this. And I was like, okay, just take time. Don't rush it. And then within 4 weeks time, he was like, I could do it. Yeah. I was like, good. Let's keep doing it.
I mean, I actually have on nerve entrapment.
Yeah.
It's not major, so I've never really done anything with it because I can manage it just with stretching.
Yeah.
But sometimes what I find is when I'm, writing or when I'm typing or when I'm just, in bed with my arms, not even looking, just my arm, just instead of being straight, it's folded. I get pins and needles in my last 2 fingers.
Yeah.
And I know it's something to do with this.
That's it.
So as soon as I do this stretch,
yeah,
I can feel here, it's the nerve is being taut.
Yep.
I hold it and then immediately relief straight away.
Yeah. Yeah.
And I think people who have tingling sensations or something, Google nerve flossing, followed by the body part where you've got
it.
And I think it's a brilliant thing to do.
It's really good because a lot of people don't know what's going on with their body, and it's like, I just can't. It can't work. I can't do this. I can't do that. I can't do that. And it's like, right, just find that nerve flossing technique.
Yeah.
And of course, you need to find, like we said, the right body group. And if you can't, just go and see someone, and then you will be able to get a bit more understanding of what's going on. And that's why I like to tell people, or the patients that come and see us or see me, is that I want them to understand what's going on in their body.
Yeah.
Right? It's not just, oh, you've got this pain. That's it.
Yeah.
It's like, you've got this pain. The reason why you may have this pain is because of this. This is what it is. This is a diagram. I'm going to show you how to do this movement. And if you want to prevent these injuries, then you need to do this, this, and this, X, Y, and Z. So that's the option. So for example, if someone's got like pain in their arm, and they're thinking, I'm getting pain here, and I'm like, oh, it most likely could be from your neck. If they're getting shooting pain coming down to the fingertips, and it's like, it could be let's do some tests. And it's like, no, I don't think it's coming from the neck. I'm like, but if we do this and we do the neck and you rotate your head, is your pain gone? Yes. Oh, okay. So let's try and investigate why. And they're like, oh, okay, I'm understanding now.
Yeah.
And I'll show them a diagram. They're like, oh, okay, this makes more sense now.
Yeah.
Then now they can see it.
Yeah.
So
they get it.
Yeah. Not just like, I'm just telling them like, what?
Yeah.
Yeah.
And another thing I wanted to ask about, if people are happy to try and think about longevity in their life in this context.
Yeah.
Mentioned some of the things that you do in your active rest day, which people can try and also do. You mentioned very briefly that people can do some ball work as well.
Yeah.
I know what that is, but could you explain what you mean by that?
So trigger ball, we've got lacrosse ball. Lacrosse ball is like a spiky ball.
Yeah.
Small spiky ball you can put into your back or your chest or your shoulder, any type of the muscle group, and it will just release some of that, the trigger points or myofascial release.
Yeah.
So myofascial release is basically a fascial chain where it's restricted.
Yeah.
And then the point of the ball is pressing down on that area, and you're just releasing that fascia or that chain of fascia to be released to get a bit more length into the tissue.
Yeah.
So trigger ball, you want to use a trigger ball. If you're feeling tight in maybe, for example, your hamstring, and you can't fully extend or fully bend your hamstring, then you want to put the ball underneath your hamstring.
Yeah.
And then fully extend the knee and bend the knee. And you want to find a sore spot. Once you find a sore spot, sit into it.
Yeah.
And then you just want to extend and bend. And what it's going to do is put pressure on that area of the fiber.
Yeah.
And then you're basically grinding, breaking down that scar tissue that's forming that area to lengthen the tissue. That's what a trigger ball does. It triggers that point, stays into the area and releases the area to get a bit more length. And then lacrosse ball is the same, but different patterns, different shapes.
Yeah.
And you can even use a dog ball if you wanted to.
Yeah.
Or even like a tennis ball.
Yeah.
Different textures, different
amounts of pressure from how hard and soft.
Yeah. So I usually tell them to use a trigger ball that's quite dense.
Yeah.
If it's too hard, then use a tennis ball.
Yeah.
Or use they can even use a golf ball. So people that have got plantar fasciitis, which is basically tight fascia on the base of the foot, where it's really tight, and also the muscles have gone tight as well. Some people use a bit of ice bottle and roll their foot on it. That's what a lot of people do.
Yeah.
A frozen bottle, roll their foot because it's nice and cold. It reduces inflammation at the same time. And they can roll their heel and their foot onto that area of the on the foot on the area, and also you should be releasing the calf muscle groups as well because they're all kind of connected to the foot. But yeah, releasing that, or you can use a golf ball, quite small, really get into those nook and crannies of the muscle groups. Or you can come and see me. I can get my thumb in there if you need. But yeah,
with the balls, the most amount of force you can put on is whatever your body weight is.
Yes, yeah. You to be honest, you don't really you can put a lot of weight on through that area because your foot can take a lot of load
Yeah.
naturally. But yeah, you can put a lot through. Yeah, but don't go to a point where you're like screaming for pain and you're crying and everything. But just kind of get your way into it. Once you find that sore spot, kind of move your toes, crunch your toes, get those muscle groups working to crunch your toes while the ball is underneath that tension at the same time to lengthen and break down that tension through the muscle group.
I mean, I try that with the hard ball.
Yeah.
It's not rock solid. It's just very dense rubber.
Yeah.
What I found is if I've ever had an issue, maybe with the side of my glute or something like that, or at the top of my hamstring, you know, one problem I find is dedicating time to doing this because I'll be so engrossed in my work, I forget.
Yeah.
And then I realize, you know, when it's the next day, I forgot to do it yesterday and it's too late.
Yeah.
So what I found is, you know, when I'm working, I'll have that ball maybe on my desk to remind myself.
Yeah.
And I'll just put it on my chair and I'll sit to one side so it works into my hamstring.
That's it.
As I'm actually doing it, and that helps a lot.
You could even cross your leg, one of your legs.
Yes.
Because the glute is going to be stretched. And then you pin the ball down while you're sitting. Now, it's going to be a little bit awkward to sit in that position, but you can do it. And then once your leg is in that position where your leg's folded onto the other leg, your glute's going to be stretched, the ball is going to be pinned down, and you're actually just lengthening the tissue. And then once that tissue is lengthened, you're getting the ball into that direct point because it has a bit more range on that tissue now. So you can direct it into that trigger point, releasing it, hold it for like 30 seconds, repeat, and then you're just doing that. And then you can also just maintain a light stretch through that motion. You'll see the tissue a bit more lighter, have a bit more of a sponge feel as well. So that's a really good way to release some trigger points as well.
And correct me if I'm wrong, but the difficulty I have with using that technique, it'd be on my back or my hamstring or something like that, it's very difficult to get deep because muscles are layered.
That's it.
As you know. And for me at least, unless I'm doing it wrong, you know, I can only get the superficial layer muscles.
Yeah.
The deeper ones, it's impossible.
It's really hard. Yeah, it's really hard. So look, with the trigger ball and the foam rollers as well, they only go to a certain degree of pressure because naturally your body will stop you from a certain amount, or you can't get into it because it's harder to get into it. Yeah. So this is where we come in and we just kind of work into the
you can put your whole body weight through.
I can put my whole body weight through. I can load into the tissue. I can move your hip at the same time if I'm working into the glute. I can get into those areas. I can put your knee towards your chest and then really get into those different angles where like the glute medius on the side of your glute, we can get into that when you're laying down or you're supine or like laying up, facing up, or on your side. Where I can get into those different angles, and this is where we come in and really like lengthen tissue. So yeah, with a trigger ball, you can get into it, but some people prefer. It's hard for people to get into it, and they prefer to come and see someone that really knows what to do and to get into those direct areas.
What if someone wants to use a trigger ball, but they're looking at areas, say like the traps? Yeah, is it possible to do it with that?
It's possible, but it's hard. It's really because the ball slips off quite a lot.
Yeah, you've got to lean against a door frame. I find. That's it. And even then, frankly, when I've tried it, like because this is like a hill coming up. Yeah, it's like trying to balance it on top of the hill.
That's it. It's hard. It slips off.
And
it just slips off.
And as soon as you push into it, it's going to go slightly to the side and then it comes off again.
So you can get different types of like equipment for that. So there's one like a hook where you can literally put it behind your back and then it's like an actual hook.
And you squeeze it almost.
Yeah, you pull down and it pulls down into your trap. Right. So there's other ways you can do it. There's ones on you can get online. You just kind of get like a nice big hook, bring it behind your back, and there's ones that are very weird shapes where you can feels a bit more comfortable for your arm to get through, and you just literally have it on there and you pull down and it'll pull down into your trap and just release, and you can start to mobilize your neck through those areas to pull that area, or you can just, of course, the ball's bloody hard to get into those areas, but I can imagine.
With a trigger ball, is there any part of the body that you would recommend people just not even trying to attempt for safety reasons at all?
Neck. Don't do it.
Avoid the neck.
Yeah, don't do it.
Why is that?
There's just too many small articulate areas that are very sensitive, and if you don't know what you're doing, then don't do it. Just don't do it. It's like
so traps and below is okay.
Yeah, traps and below is okay. Just be careful with your spine, of course. Yeah. If you're very like sensitive, be careful. I wouldn't say to put yourself into a position where you're not comfortable in, or get some specialized help or someone to help you to support you in that position. Then you know what you're doing. Videos or getting someone that knows what they're doing is better than just doing it yourself and going somewhere. It's like, oh, let me just try to put it on my neck, and next thing you're like,
You got an injury there.
Yeah, I really hurt myself. Yeah, I would definitely say like just get some professional help first if you want to get into releasing those areas. So the neck is very fragile. It's like it's so fragile. So
vessels, nerves.
it's really arteries. Yeah, exactly. So it's just you've got to be careful when you're putting pressure through these areas. Even like using a massage gun, don't use a massage gun here. Like I always say, because it's a very fragile area. So a lot of percussion through hitting joints and everything. Like you got muscle here, but it's not like big muscles like the back. You got muscle, but it's not thick as the back as well.
Unless you're a professional bodybuilder with perhaps that you can see a mile.
Literally. Then I'll be like, maybe, there's nothing there. You only got a little bit of muscle and also tissue around the area of the joint to protect the neck. Even though it's strong, it's not as strong as like putting a load through of the ball into the neck and then rolling across there like that with it's a lot on the actual joints, on the actual side of the joints as well. So I wouldn't really do that.
I would a neck.
You can. There's ways you can like lay on a foam roller and just have it in the extension.
And that's it.
That's fine. But rolling on it, that's too much. That's way too much. I think anyway.
No.
Okay,
fine. And that moves us onto very, very nicely. I want to ask you about these massage guns that people are getting. First question is, does it really matter which one you get?
From my experiences, there's some really, really weak ones where they're quite weak, but people might
weak in terms of the amount of force being delivered.
Some people might like that, like elderly. They might like that where it's just very light and it's not causing too much damage on the tissue where they're getting a lot of contusions or anything, or like any swelling or anything, but just anything light. I guess that works for some people. And then some people really like a lot of athletes like the really expensive, powerful ones. They're quite good. You can just get into the muscles of the quad quickly before they run or after they run, trying to get that stimulation, which is good. So massage guns, I think it's a really good tool. I think it's a really good tool because it's quick, it's easy to use, it's handheld. You can bring it with you wherever you want.
Is there any particular brand, and feel free to mention brands, that you personally recommend or don't recommend?
So I recommend the one that we're using. I think it's called...
I think you've got Theragun in clinic.
We've got Theragun and Brad and... I've got the company, Brad and something.
Okay.
Why
do you recommend those?
Because I've used them and they're really good.
It's
personal experience. They're really good. They're quick. They do enough percussion through the tissue per second. It's really quick and it's reactive as well. It helps with like your nervous system as well. It helps with like edema. You've got a lot of edema and swelling,
lymphatics flow and things like that.
Get through the calf, kind of glide across there. I like using my hands, but you can use the massage gun, especially if you're at home. If you're at
100%,
and you're like, oh, got swelling on my kind of just massage gun and just kind of glide across that, and you get some nice flow of blood circulation.
Is there any, have you seen people misuse these and cause injuries to themselves? So what is it they're doing that makes them worse off as a result?
I would definitely say don't use it on your neck, I think. Don't do it on bone. That's a lot of damage. Any sense, I wouldn't do it. To be honest, I wouldn't do it anyway on the head, face, or in the neck. And if you already got bruising, I wouldn't do it because there's already
it's already inflamed.
It's already inflamed.
It's get worse.
But if you've got edema or there's like a lot of pool of swelling on the legs, you can do it on there gently, kind of help with circulation because your calf is like a second. It's like a heart, so it's like a pump. It can pump. So you work along the calf and do some venous return, which is basically any appendages like your arm or your leg, bring it towards the heart. So you want to glide upwards towards that. Will help with the circulation of your blood flow and also the lymphatic system. And that will help get rid of the waste product.
And you've got the settings on these things.
If
you go to the lower RPM versus the higher RPM, is there any risk? Any bad?
I mean, when you go to the higher RPM, there's more hits per second, but it might feel a little bit more tender sometimes. But the lower one is better for people that are first starting off, and then they can gradually increase it when they feel like.
So there is benefit to the higher RPM.
There's a bit more benefit, quicker blood flow. You're going through more tissue, which is much better, and there's a little bit of heat towards it sometimes. You can even get the heated ones that are quite good as well. The heated ones, I haven't tried them myself, but I've been hearing the reviews are quite good for them as well. So you can get the heated ones with a different head. and you just touch the head, you heat it up, and then you turn it on, and it can work through those areas where it can help with lymphatic drainage, soft tissue muscle to get lengthening of the soft tissue quicker. But yeah, there's two different ways. You can use a slower one or the faster one. You can to keep on interchanging in each one, just to kind of get in through different muscle groups. You can get, so with the calf, you can go from like a fast pace of the area of the calf into a slower pace. And when you want to get into like a specific area of the calf muscle, like the gastroc medial head, you just want to get into that little spot. You just kind of hold it there. And just do like slow RPMs and just kind of hit that area, just to kind of work into it a little bit more. And then from there, you can do a bit of Graston as well.
Okay, better blood flow.
Let's get some blood flow. Different techniques, different lengths of tissue, different ways of working into it as well.
So if someone's been to the gym, let's say I've just come back from the gym, been doing, I don't know, deadlifts, back's a little bit sore.
Yeah.
Is there a minimum amount of time I should wait before I put it into the sore area?
Not really, no.
Even in the gym, perhaps.
You could do it in the gym. Yeah. They have it in gyms now. So
I've seen,
you can do it in the gym. But I would say if you're injured, if you pulled something and you're injured, I wouldn't just say like start using the gun straight away on there or anything. I would say, look, okay, let me just take a break, rest it, or go and see a specialist, someone to see what's going on. If I feel like really, really injured myself, then I was like, don't just get the massage gun or trigger ball and try and release it and try and if you know you injure yourself, don't try and test things out. Just like, look, I'm gonna, unless you've seen someone before and they've said, look, just do these exercises. If you pulled yourself from this certain position from before, then like, okay, cool. But if you don't, go and see a specialist. It's because it's the unknown. You don't want to be trying new things and trying to play around, finding new ways to release it.
Yeah. So if you were, let's say, my personal warm up, let's say I'm squatting and deadlifting that day, I'll do those in the same day. My warm up is the squat and the deadlift. But it will be, in the squat, at least, let's say, it'll be just the bar. Then I'll go up in increments of either 40 or 50 kilos. So I'll do a rep on each, and that is the warm up.
Okay.
Would adding the massage gun in that time period, as part of the warm up, all over, just in general, is there any benefit to that, perhaps?
It may increase your blood flow, which will help with contraction.
Of
the muscle groups. It might help with the receptors of the nerves to get a bit more quick firing muscle groups, to a bit more twitch fiber muscle groups as well. So it can help. Definitely.
But then what about in terms of power then? Okay, because if it's going to do that and lengthen the muscle, would it not reduce the power?
Most likely. Is the thing.
So it depends on what kind of training you're doing.
Yeah, exactly. Because with the massage gun, it's there to get into tissue and also lengthen and also relax sometimes the tissue as well. But at the same time, it's helping the receptors of the nerve system to be more quicker as well, to be able to fire. So it can backfire on you as well.
Okay.
So it could backfire.
So in that case, I guess if you're someone who is squatting and deadlifting and you want to do it heavy,
yeah,
would you say that if you were going to use the massage gun in that warm-up period, it can help if you keep it lower RPM and you don't push in?
Yeah, I wouldn't push in.
Very, very superficial, light work.
I'll just glide across. I'll just glide across, working into the fascial chain, working into, I wouldn't be like drilling in any of that.
Single hand.
Yeah, just gliding across, getting there for 10, 30 seconds and just like maybe 30 seconds, just getting in there, getting into the glute a bit, because it's got a lot of mass on there. So just getting into the glute. I mean, you can go a bit more deep on the glute because there's some more layers, but generally just getting lightly in the glute and then just go from that point. But I wouldn't be using it on every day. Like, okay, I'm doing squats. Let me just quickly.
Really? Okay.
I wouldn't do that. I mean, you can just naturally for me anyway, I just focus on my stretches and then that will be beneficial for me. But for like people that want to get in there, you can. I've seen it before. I've seen it many times where people use a massage gun in there and then just quickly lengthen the tissue on that area. Maybe because there's an injury from before, quickly warm up the tissue around there to get the full range of motion of the knee from that quad.
Right.
Just to kind of warm up that tissue of the rectus femoris where it's coming up from the hip to the knee, just to warm it up because they can't get that full range, or from the hamstring or from the hip. So it is beneficial. I think it's beneficial because you can actually get some movement through the muscle groups instead of being cold where we had an injury before, or just where it's stuck, or in between sets, you can do it. Yeah. I don't think it's like end all be all.
Yeah.
But I think it is.
If you got the money, you got the budget.
Yeah.
Sensible.
Yeah. And I think it's really good for build up of fluid, like retention.
Edema.
Yeah. Edema. I really think it's like recovery is good.
Yeah.
I think it's good. It's a good tool to work on if you haven't got anyone to help you massage you or get some restriction. So especially for elderly that want to move a bit more and want to get reduced all the swelling, and they can't, they can bring the legs up a bit and get reduced that area. But working into the calf lightly is good.
Yeah.
You know, with the gun, you can just go in low setting, work on that. You'll see some little bit of changes where the blood, because you're circulating the blood, which will help with the lymphatic system, circulate the lymphatic system, and it'll go around the body, and then you'll get the waste. It will help with the waste products in the areas that are restricted.
Absolutely.
Yeah.
So in terms of you know, going and seeing someone,
Mm-hmm.
because we talked about quite a few different things. I know some people will be trying some of the stretches, the ranges of motion that we talked about.
Yeah.
Maybe they realize for the first time,
Mm-hmm.
I can't do what he's just said.
Mm.
So what kind of person should they go and see? Should they see a sports massage therapist? Should they see a physiotherapist? Should they see an osteopath? Should they see a chiropractor? How do they even work this out?
Okay, so if it's joints if it's spinal health, I'll definitely say see an osteopath or chiropractor, because they work in the joints, work in tissue, work in the nerve system, working into the actual movement of the spine. So if they can't do those movements, then I'll say, look, definitely see one of the people that are specialized in those areas, because they work in not just the spine. Osteopath works into the joints as well, the shoulder, the hip.
Almost MSK, really.
Yeah, so you might as well go and see someone that specializes in that to help you move. It's especially if you have no range of motion as well. Like you have restricted range of motion, you're kind of limited, and you want to get moving again.
Yeah.
So yeah, I would definitely say, like, look, see someone like that, because they will really help with your movement. And for me, I will help you increase your range of motion with releasing some of the tissue that is stiff. For them, they will be focusing on other things as well as that, because they specialize on a broad spectrum. So it's really, really important. If you feel like I can't bend forward, come on through. We'll help you in that path. So it's really important for that. If you feel like you can't rotate, then come on through.
Yeah.
Because even if you go to a different clinic or different area, or even the NHS, like, you can really find a physiotherapist that can do it as well, that specialize in movement and biomechanics as well. I think it's really important for the people to be moving. I mean, because we're living in like a world where it's just office based most of the time.
Very unnatural.
Yeah, it's like if you're sitting there for that long, and it's not just like 1 month, 2 months, it's like a year's time, and you're feeling stiff.
Yeah.
You can't get, and then you want to do a marathon that year.
Yeah.
And you're feeling stuff, and you can't get that full range of motion. And you need to come on in.
100%.
You need to come on in, man, because you're really stuck.
And then depending on where they are in the country, they talk about UK specifically, they can translate the currency.
Yeah.
If someone was to look for a consultation with a well-qualified, experienced, say, osteopath, what kind of price range are they looking at for an initial consultation, maybe with or without treatment on that day?
Usually it varies from I think it's £100. For consultation.
Yeah.
But it varies in different locations of London.
Sure.
I think more central, it'll be like around 100.
Yeah.
90 to 100.
Yeah.
You can get some for 80 as well. And if you can go on the outskirts, you can get some for like 70 ranges, and some have their own private osteopath clinics as well, and they'll give their own range. But you'll just say the range from now is like 70 to 100.
Yeah. And then remainder of the country is not going to be as high as London.
No, it shouldn't be anyway.
Yeah.
It shouldn't be. That I know of. I don't think it should be. It should be a decent amount.
And then what about if someone was to come and see a sports massage therapist?
Yeah.
Typically, they're going to buy a pack of sessions, because you can't fix things in one go. But so what kind of pack sizes are the most common, and what kind of price are we talking?
So usually the pack sizes are 10 to 15.
Yeah.
Then we can see some results. 10 is a result of, in these sessions with exercises and stretches, you should get a result of this. And that's usually about 900 to a grand.
Yeah.
So that varies though. You can get some for a package of, for some people, 500, 400 as well, of minimum of half an hour sessions as well. So those are really good. 15 packages if you're feeling like you need more treatment and you need that longevity as well, then this will be beneficial for you. And then we will just go, what do you want from this? And what's your main goal?
Yeah.
And then we work into those areas, and then we'll say, this will be the best package for you because this is what you want. So for example, if someone wants to do a triathlon, cycling, swimming, and running, I think you should pick this because this package of 10, because you already do stretching already, but you just want to loosen up.
Yeah.
And we've got a whole month and a bit before the actual triathlon.
Yeah.
Cool. Let's use those packages, use those sessions in that span of that month, and then we'll see how you go from there. Yeah. And if they've came before and they're like, you know what, I like that 10 package, but can we do 15? Or can we do 8? Or, you know, you're like, okay, cool, let's do that. And this is the range on how much it will be. And then we'll work through those areas as well. And then they can just change from there. So, oh, I'm really busy this week, but I really need to come in. Can we do half an hour quickly? Yeah, sure, quickly. Let's come and do half an hour and work in some of the muscle groups that we need to focus on for your event. And then we'll come back.
And then if someone wanted to come and see you specifically, could you give us an idea of where you work in terms of the clinic and the city and things like that?
So I work in Freedom Clinics. That's in Canary Wharf.
In London.
Sorry. So it's a private clinic. We have osteopaths, we have sports massage therapists, we have chiropractors, we have sports doctors, MSK sports doctors, acupuncturists, and also podiatrists as well. Chiropractors as well. So we've got quite a range of people working in the clinic, and which is really good. I've been working there for about 3 years now. So my price range is our price range is £100 for an hour and £70 for £60 for half an hour. And then a 90 minutes is 150. So that's the range from there. But we're not just doing massage, we're doing assessment. We're doing consultation and assessment. We're checking your range of motion. We're also checking to see if there's any restrictions in these areas, dysfunctions, and I'm making sure that you're getting the actual full amount of work done in that area, especially. So say, for example, it's your shoulder and your chest, and we'll work through those areas. And if I find a dysfunction elsewhere, I'm like, look, this is the area that's getting restricted. You need to work in this area because it's affecting your chest or it's affecting your shoulder. And if I can't find anything that I don't know, I'll refer you straight away to see somebody else as well, to help with that issue. I had someone with snapping scapular syndrome. So the scapula on the wing on the rib cage is just keep on gliding, and it's just basically gliding across the bone. So it's making a massive clunk. And that is a real issue for some people. So it glides across and it just makes a loud clunk noise. So the bone on bone is not a really nice thing because it gets degeneration. There's a lot of degeneration on them.
You get that in the temporomandibular joint as well.
That's it, So usually the bursa is basically gone, usually, if it's a loud one, and you got to send them for a scan. So if I see stuff like that, like, look, these are the exercises you might need to do for yourself. See a physiotherapist, and then also get a scan as well, because this is going to be a chronic thing. If it's not sorted out now, it can be chronic. But if you sort it out before, we can work into this area. So let's not leave it for like 5 years down the line, you know. So that's our way of working as well.
Fantastic. Well, Ramone, it's been a pleasure.
Thank you.
There's so much stuff we haven't even covered.
There's more to go through.
We're about 3 hours in. So people know where to find you. I'm sure we will get one of your colleagues on at some point
100%.
as well. And because there's so much stuff we haven't even spoken about, but I'm sure maybe at some point we'll get you back.
Oh, please do. That'd be great. Please.
But thank you so much for coming on.
Thanks, Thank you.
And hopefully see you again.
See you soon. Thank you, man.